Infectious diseases, preventive medicine and clinical species conferences. Mammal and avian clostridial diseases. Endospore-forming gram-positive rods and cocci. The genera included in this group have diverse characteristics and are only grouped together for convenience because of their ability to form endospores. Of the 6 genera contained within the group, only species in the genera Bacillus and Clostridium are of veterinary importance. The endospores that are characteristic for the members of this group are round or oval and form within the bacterial cells. These spores are highly resistant to the lethal effects of heat, desiccation and disinfectants, which allows them to survive in nature for prolonged periods, sometimes for decades, a factor that is important in the persistence of the bacteria in the environment, and in the epidemiology of the diseases caused by them. Taxonomically, the genera Bacillus and Clostridium belong to a major and diverse group of bacteria known as the Bacillus/Clostridium group, low guanine and cytosine gram-positive bacteria, together with Listeria, Staphylococcus, and Streptococcus. Clostridium is then placed in the family Clostridiaceae and Bacillus in the family Bacilliaceae. Species of bacteria within the 2 relevant genera in this group cause the oldest, and most destructive diseases known. Bacillus anthracis, which causes anthrax, a highly fatal and contagious disease of humans and animals, is the only species of the genus that is an important pathogen, although some of the others, such as Bacillus cereus, are opportunistic pathogens. Numerous clostridial species, on the other hand, are causes of disease, their pathogenicity being mainly dependent on their ability to produce a range of toxins that have diverse effects, including histotoxicity, hemolysis and neurotoxicity. These toxins are elaborated in and absorbed either from the lumen of the intestinal tract of an animal, resulting in an enterotoxaemia, pulpy kidney disease, or foci of necrotic tissue, tetanus and gas gangrene, or they are produced in feed or decomposing matter of animal or vegetable origin, botulism, which is a form of food poisoning. Clostridium piliforme, formerly named Bacillus piliformis, the agent of Tyzzer's disease, is included in the genus Clostridium based on phylogenetic studies on the 16S RNA. It is phenotypically similar to other Clostridia in that it is a large rod, is motile and produces subterminal spores. Unlike other Clostridia, it possesses a gram-negative cell wall and is an obligate intracellular pathogen. Neurotoxic clostridial diseases. Tetanus is a non-contagious, almost invariably fatal neurointoxication, particularly of horses and sheep, occasionally of cattle, goats, pigs and humans, and rarely of dogs and cats. The disease is caused by Clostridium tetani and usually develops after deep, anaerobic penetrating wounds have been contaminated by the organism. Necrotic tissue in such tissue injuries creates the necessary anaerobic environment which allows the organism to grow as vegetative form, and produce its potent neurotoxin, tetanospasmin, which causes the rigidity and tetanic muscle spasms characteristic of the disease. Owing to its distinctive clinical features, tetanus is usually readily recognizable, particularly in the later stages of the disease. It was described by Hippocrates in the early records of medical history and, even in modern-day human and veterinary medicine, it remains an important clinical entity that requires prophylactic vaccination. In the developing countries it is a serious public health problem, with 50,000 human fatalities being reported each year. Clostridium tetani is a gram-positive bacillus in young cultures, becoming gram-negative in cultures that have been incubated for longer than 24 hours. The bacteria occur singly or in pairs, and measure 0,5 to 1,7 times 2,1 to 18,1 microns. The bacterium is moderately fastidious in its anaerobic requirements. After 2 days incubation on blood agar, the colonies are 2 to 5 mm in diameter, slightly raised, feathery, semi-translucent and gray. They have an irregular or rhizoid margin and are surrounded by a zone of hemolysis. Most C. tetani cells are motile due to the presence of paratrichous flagella which allow them to swarm on media with a moist surface. Non-motile strains also occur. The most characteristic microscopic morphological feature of C. Tetany is the development of round to spherical terminal spores which cause the bacterium to bulge, giving it a typical drumstick appearance. The spores are unable to retain gram stain, and are resistant to many standard disinfection procedures, including steam heat at 100 degrees Celsius for 30 minutes, but destroyed by autoclaving at 115 degrees Celsius for 20 to 30 minutes. Clostridium tetani grows well on most laboratory media, its nutritional requirements being satisfied by various growth factors in the peptones and tissue extracts present in the media. The optimum temperature for growth is 37 degrees Celsius, though there is still moderate growth at 30 degrees Celsius, but no growth at 25 degrees Celsius. Its growth in cultures is also inhibited by the presence of 20% bile or 6.5% sodium chloride. The organism is metabolically relatively inactive and does not produce acid from carbohydrates, lacidinase or lipase, and neither does it hydrolyze esculin or reduce nitrate. It is a typical example of a non-saccharolytic and only slightly proteolytic Clostridium. Certain strains may, however, ferment glucose and inositol, and most strains hydrolyze gelatin and produce indole. Clostridium tetani is susceptible to metronidazole, penicillin, tetracycline, erythromycin, chloramphenicol, clindamycin and augmentin, but it is resistant to the aminoglycosides and cephalosporins. The vegetative forms of Clostridium tetani synthesize two very potent toxins, tetanospasmin and tetanolysin. A structural gene on a plasmid codes for the production of the toxins, the absence of the gene being the reason for the occurrence of non-toxigenic strains of Clostridium tetani. Tetanolysin, a hemolysin, is an oxygen-labile, membrane-damaging toxin that plays no role in the pathogenesis of tetanus. The main toxin, tetanospasmin, is a potent neurotoxin and is produced intracellularly in the bacterium, being discharged into the surrounding medium as the organisms die, undergo autolysis and disintegrate. It is very susceptible to heat, being destroyed by 20 minutes exposure at 60 degrees Celsius, and can be produced in vitro and purified within 6 days. Tetanospasmin has a molecular weight of 150,000 Daltons, and is composed of a heavy chain, 100,000 Daltons, and a light chain, 50,000 Daltons, linked by a single, disulfide bond. It appears that the light chain is the toxic portion of the molecule and that the interchain disulfide bond plays an important role in membrane translocation of the toxin into nerve cells. In mice, tetanospasmin is lethal at a dosage of 1 nanograms per kilogram body weight, whereas the lethal dose is 0.3 nanograms per kilogram in guinea pigs and varies from 0.5 to 5 nanograms per kilogram in rabbits. Tetanus occurs wherever animals are farmed. Susceptibility varies considerably among the different mammalian and avian species, with horses and humans being the most sensitive to the effects of the toxin, followed, in order of sensitivity, by sheep and goats, mice, rats, rabbits, monkeys, dogs, cats, pigs and cattle, while birds are the most resistant. The spores of Clostridium tetani are present in soil, dust, and the feces of most herbivores, but their distribution is unequal, which probably explains why tetanus is more common in some districts than in others. The fact that Clostridium tetani is part of the normal intestinal flora of many animal species plays an important role in the dissemination of the organism. It appears that the vegetative organisms in the intestinal tract of animals may replicate and produce toxin, leading to the formation of tetanus antitoxin following its absorption. The possibility of autointoxication from the gut has been confirmed. Though wounds of any nature are prone to become contaminated with Clostridium tetani, deep, penetrating wounds such as those caused by nails penetrating the hooves of horses are most often associated with the development of tetanus. In addition, wounds associated with castration and tail docking operations, bites, permanent tooth eruptions, compound fractures, shearing, the umbilical stump of neonates and frostbite may also support the growth of Clostridium tetani. In lambs, tissue necrosis following the application of elastic rings for tail docking and castration creates ideal conditions for proliferation of the organism and toxin production, resulting in the development of tetanus, sometimes in outbreak form. In cattle, it rarely occurs after penetration of the wall of the reticulum by foreign bodies, and as a result of uterine retention of the placenta after birth. In some cases, it may be difficult or impossible to locate the portal of entry of the organism, as the wounds in which it was located may have healed, leaving the spores to lie dormant in the tissue for varying lengths of time, from months to years, before germinating if and when conditions become favorable. The spores of Clostridium tetani are introduced into a wound, together with soil, feces or other contaminated material. Tissue necrosis and infection of wounds with other microorganisms predispose to the germination and growth of the organism by creating an area within the tissues with a low redox potential. Clostridium tetani is non-invasive and remains localized at the site of entry, where it produces neurotoxin, tetanus toxin, tetanospasmin, for as long as conditions are favorable. It is assumed that tetanolysin is also produced in the wound, but that it does not play a role in the pathogenesis of tetanus. Several factors influence the length of the incubation period of tetanus, the amount of tetanospasmin formed in the lesion, the toxogenicity of the infecting strain, the amount of the toxin entering the blood circulation or neural pathways, and the susceptibility of receptors in the neural pathways. The incubation period may be very long, as spores of Clostridium tetani may remain dormant in tissues for months or years until sporulation is triggered by the development of a necrotic area in their vicinity. Weak toxin-producing strains do not produce sufficient neurotoxin to induce clinical tetanus. Unlike the botulinum toxin, tetanus toxin cannot be absorbed from the intact intestinal tract, although it has been suggested that it can, if intestine are damaged by other pathogens. This is because it lacks the complexing proteins that are required for the toxin to cross the intestinal epithelial barrier. Tetanospasmin produced in wounds reaches the central nervous system by one of two routes, either humoral through the lymph or blood streams, or by way of the peripheral nerves. In the latter instance, also referred to as ascending tetanus, it enters the nervous system by endocytosis at the presynaptic terminals of motor axons, and then ascends by retrograde intraaxonal transport to reach the ventral horns of the spinal cord, from where it diffuses cranially. Ascending tetanus is demonstrated under experimental conditions by injecting a sublethal dose of tetanus neurotoxin intramuscularly into the hind leg of a rabbit. The leg into which the toxin was injected goes into spasm, followed by the muscles of the opposite leg, and then the muscles of the back and abdomen. Descending or generalized tetanus is the form that usually occurs in livestock and humans. In this form, neurotoxin is produced in amounts too great to be fully absorbed locally by the motor nerve endings. These excess amounts of toxin are taken up into the lymphatic and blood vascular systems, but are prevented by the blood-brain and blood-peripheral nerve barriers from directly entering the nervous system. Circulating toxin gains access by endocytosis at nerve endings throughout the body, from where it is transported up the axons to the central nervous system. Certain motor nerve centers such as those of the head and neck have short nerves supplying them, resulting in clinical signs appearing there first, followed by those in the upper part of the body. Tetanus toxin acts on the central nervous system mainly at synapses, primarily by irreversibly blocking transmission of impulses by inhibitory neurons which prevent the contraction of a muscle or groups of muscles when the antagonistic muscles contract. Tetanus neurotoxin, a zinc endopeptidase that is structurally similar to the botulinum toxins, is composed of two disulfide-linked polypeptide chains. The larger of the subunits is responsible for binding to neurons. The smaller subunit binds to the VAMP or synaptobrevin, causing inhibition of the transmission of impulses by preventing the release of neurotransmitters. No structural lesions are induced by the toxin in nervous tissue, the lesion being purely biochemical and the result of a presynaptic blockade of gamma-aminobutyric acid or glycine release at inhibitory synapses on motor neurons. These effects result in a state of constant muscular spasticity, and give rise to exaggerated responses to normally innocuous stimuli. Sustained spasm of the respiratory muscles eventually causes death by asphyxiation, cardiac arrest and general exhaustion. Excitatory transmission is also inhibited at a late stage of the intoxication. Clinical signs. The incubation period of tetanus may be as short as 3 days, but it usually varies between 1 to 3 weeks after infection has occurred. In exceptional cases it may be as long as several months or even years. Initially, a general increase in stiffness of voluntary muscles becomes evident and is followed by tetanic spasms of all muscles, particularly when affected animals are disturbed in some way by external stimuli, such as handling, noise, emitted by the clapping of hands, or even sight. Trismus with restriction of jaw movements, spasms of the nostrils and tail, prolapse of the third eyelids, hyperesthesia and stiffness of the hind legs are common signs. Death usually follows within 12 to 72 hours, but the course of the disease may occasionally be prolonged in the more subacute to chronic disease, from which some animals may even recover. Lambs, older sheep, and goats usually develop the acute disease. Affected lambs do not suckle, have grinning facial expressions due to contractions of the facial muscles, and hold their heads high and their legs wide apart. Owing to the spasms of the muscles of the limbs, flexion of the joints becomes virtually impossible and affected animals move with great difficulty. If the animals are startled, they fall down in lateral recumbency and go into spasms, showing up as Tetanus with the legs stiffened and outstretched due to more forcible contraction of the extensor muscles. Death occurs after 3 to 10 days. The case fatality rate is approximately 100% in animals manifesting clinical signs. In horses, the clinical signs are characterized by the presence of flared nostrils, a sawhorse stance, severe muscle spasms, trismus and prolapse of the third eyelids. See movie and photo in PW. When trismus occurs, the mouth is held tightly closed and manual attempts to separate the jaws are generally unsuccessful. Other signs may include constipation, colic, retention of urine, inability to eat feet off the ground, opisthotonus, sweating, dyspnea, hyperesthesia with an anxious facial expression as a result of spasms of the facial muscles, and staring eyes. The ears are erect and the tail is rigid and is usually held sideways. The pharyngeal muscles are also similarly affected and saliva dribbles profusely from the mouth. Affected animals eventually go down, assume a position of lateral recumbency and, as in the case of lambs and other animals, go into spasms if stimulated. The muscular spasms occur with greater frequency and have longer durations as death approaches. The clinical signs of tetanus in cattle include an extended head, a raised tail, holding the legs in a slightly abducted position, prolapse of the third eyelids, ruminal stasis, constipation, marked stiffness and, in some animals, bloating. There is pronounced dullness and depression, with the reflex nervous irritability being less marked than in horses. Lesions. There is an initial respiratory alkalosis followed by acidosis in animals suffering from tetanus, and this increases progressively as a consequence of lactic acid formation resulting from muscular hyperactivity. During the period of alkalosis, hyperkalemia is present, but this changes to hypokalemia when acidosis develops. The hypoxia that follows the decreased pulmonary ventilation due to respiratory muscle spasms causes microcirculatory disturbances in pulmonary tissue and is a major cause of mortality. Glucose metabolism is impaired but is not stimulated by insulin, lipolysis is triggered, energy expenditure increases, and glucocorticoids and catecholamine blood levels are reduced. Aldolase and creatine phosphokinase levels are elevated, the extent being directly related to the severity of the disease. Specific macroscopic and microscopic lesions are absent, except for the probable presence of an infected wound such as those seen when elastic rings are used to castrate or dock the tails of lambs or kids. A suspicion diagnosis of tetanus is usually based on the history and clinical findings. The isolation of C. tetani from necrotic wound tissue in conjunction with the demonstration of the toxin in tissue specimens may be used to confirm a diagnosis of tetanus, but this is rarely done. Specimens are obtained from wounds or any site at which necrosis of tissue has occurred and which manifests signs of infection. For bacteriological investigation, part of this material is inoculated into cooked meat or liver broth before the medium is heated to 80 degrees Celsius for 20 minutes to destroy all possible contaminants. It is then incubated for 2 to 3 days. Subcultures are made onto solid agar plates and specific fluid medium. The culture supernatant may be used for animal inoculation tests to assess toxogenicity. Laboratory animal inoculation of saline suspensions of wound material in order to determine its toxogenicity is possibly of greater diagnostic meaning than the bacterial isolation of C. tetani from such material. As a control, one or more of the animals should be given a prophylactic dose of antitoxin before inoculation with the wound suspension. The presence in smears prepared from wounds of gram-positive rods or gram-negative filamentous rods with round, terminal spores giving them a drumstick appearance can only be regarded as indicative of a possible Clostridium tetani infection, as other Clostridium spp, such as C. tetanumorphum and C. tetanoides, have a similar appearance. The isolation of C. Tetany from specimens of intestinal content taken at necropsy is meaningless for diagnostic purposes as the organism normally occurs in the intestinal tract of animals. Tetanus toxin may be demonstrated in the serum of some affected animals, especially during the early stages of the disease. Such specimens are divided for test purposes into 3 portions, one being treated with antitoxin, the second is subjected to heat treatment at 100 degrees Celsius for 30 minutes, and the third left untreated. A portion of each is then injected intramuscularly in 0,5 to 1,0 ml quantities intramuscularly into mice, which are observed for 7 days. If the serum does contain tetanospasmin in detectable amounts by this method, signs of tetanus will develop only in the mouse or mice which received the untreated serum. Differential diagnosis. Clinical signs caused by a number of neurotoxic plants may be confused with those of tetanus. In horses, tetanus in its early stages may also be confused with eclampsia, hypocalcemic tetany, acute laminitis, hypomagnesemia and meningitis. Eclampsia is confined to lactating mares and responds to treatment with calcium salts. Rigidity of the neck is also caused by cerebrospinal meningitis, and although the animal shows hyperesthesia, it is generally depressed and hardly excitable. Lactation tetany of cattle is associated with tetanic muscle spasms and convulsions, while white muscle disease in young ruminants may cause a marked stiffness but no muscle spasms. The clinical signs in recumbent cattle, sheep and goats suffering from cerebrocortical necrosis may resemble those of tetanus, but the absence of prolapse of the third eyelids and of rigidity of leg muscles excludes tetanus. The nervous signs caused by heart water in cattle may also be confused with tetanus, although they are much less pronounced and a fever commonly occurs. Although strychnine poisoning is uncommon in farm animals, its clinical signs may be confused with the early signs of tetanus. Control. The prognosis of an animal with tetanus is always guarded. It is most unfavorable when there is a short time period between infection and the onset of clinical signs, and when the development of generalized tetanic spasms is rapid. Animals should be sedated, placed in a quiet, dark stable, and treated with a muscle relaxant. The stable should contain a floor which provides good footing as affected animals have difficulty in rising, and it should also be bedded deeply with straw or wood shavings to minimize the development of decubitus wounds. The Clostridium tetani infection should be eliminated by surgical debridement of the wound, the local infiltration of penicillin G around the wound, and the institution of a course of penicillin administered parenterally. In order to neutralize unbound tetanus toxin, antitoxin can be infiltrated into the tissues around the affected area as well as administered intravenously, if the value of the animal warrants the expense. Active immunity to tetanus should be established by the administration of a tetanus toxoid vaccine, which should be repeated after about a month. The application of general nursing principles is important. This consists of such procedures as the maintenance of hydration, electrolyte balance and nutrition of the affected animal and relieving ruminal tympany should it arise. Feed should be placed in a position which allows easy access. Passive immunization with hyperimmune serum obtained from actively immunized sheep or horses confers effective protection in unimmunized animals and humans. It is effective within hours of administration, but its protection does not persist for longer than 3 weeks. It is used either for the protection of animals in which the possible development of tetanus can be anticipated because they are suffering from wounds in which the local conditions in the damaged tissues are conducive to the multiplication of C. tetani, or for the treatment of animals suffering from tetanus. Administered antitoxin antibodies will only neutralize the tetanus toxin which is in circulation, and as antibodies do not cross the blood-brain barrier, this treatment is without effect once the clinical manifestations of tetanus become evident. Following a possible initial beneficial response to the administration of the antitoxin, animals may suffer a relapse, in which case the treatment should be repeated. Awareness must be taken of the danger of repeating this form of treatment. If it is repeated after 24 hours of the first dose, the development of anaphylactic shock should be anticipated. Tetanus is best controlled by vaccination. The tetanus toxin is highly immunogenic when it is administered as a toxoid in association with an adjuvant. Adjuvants such as water and oil emulsion and aluminum phosphate are used. As horses are highly susceptible to tetanus, they should be vaccinated on a regular basis, whereas other species, particularly sheep, should be routinely vaccinated only in those instances where the disease has become a consistent problem on a property. When first vaccinated, horses over 6 months should be inoculated with the vaccine twice with an interval of about 1 month. Active immunization is effective 12 to 14 days after the initial injection, but a second vaccination 3 to 4 weeks later is required to sustain the immunity at a protective level. Last administration of vaccine are performed at 11 months of age. Thereafter they should be given an annual booster vaccination, if surgical procedures are required. Mares with high levels of circulating tetanus antitoxin titers will provide protective passive colostrum immunity to their foals up to the age of 10 weeks. The combined use of active passive immunization in horses has definite advantages and provides an immediate short-term protection and long-term immunity. This method is most often employed in horses in which the development of the disease can be anticipated because of an injury, and it should be combined with the systemic administration of a course of antibiotic therapy. Ewes that have not been vaccinated previously should be vaccinated twice during pregnancy to afford high levels of maternal antibodies to their newborn lambs. The first injection should be given approximately 8 weeks before lambing and the second injection 3 to 4 weeks later. Vaccination against tetanus does not preclude the application of standard hygiene principles during castration, tail docking and other surgical procedures. Botulism in livestock is a non-febrile, highly fatal intoxication of cattle, sheep, goats, horses, mules, donkeys and, very rarely, pigs. It is characterized by partial or complete flaccid paralysis of the muscles of locomotion, mastication and deglutition. Botulism is an intoxication and not an infection, and in livestock it follows ingestion of decomposed organic matter, mostly of animal origin, such as carrion and putrid bones, but also of plant origin, containing toxin elaborated primarily by Clostridium botulinum type C or D, and rarely type A or B. The toxins are some of the most potent toxins known in the world. Humans and other species of animals, such as dogs, mink, many species of domestic and wild birds, including turkeys, domestic fowls, waterfowls, pheasants and ostriches, certain laboratory animals and fish species, e.g., salmonids, are also susceptible. Paradoxically, botulinum toxin, known as the most toxic natural product, is currently being utilized increasingly in humans to treat a wide variety of cholinergic disorders varying from mild tics to severe forms of dystonia, such as those found in advanced Parkinson's disease. It is expected that with genetic manipulation, the toxin may also be developed into an efficient carrier of oral medicines and vaccines. Botulism and its association with the ingestion of improperly preserved food has a long history in humans. The main sources of intoxication are meat and fish products, as well as non-acid vegetables such as beans, peas or beets. It was first described in humans in Western Europe and Scandinavia by Kerner, 1786–1862, and van Ermengem, 1851–1922. Kerner associated the occurrence of botulism, which was sometimes referred to as Kerner's disease, with improperly prepared German sausages including Schlackwurst, Leberwurst, Blutwurst, and Preschkopf. In 1912 van Ermengem isolated the causative organism, a spore-forming, obligatory anaerobic bacterium, from spoiled meat and suggested that the bacterium be called Bacillus botulinus, the latter name being derived from botulus, the Latin word for sausage, and the disease became known as botulism. 7 toxin types of C. Botulinum, designated from A to G, are currently recognized. Botulism occurs in many countries of the world in situations where Clostridium botulinum is present as a saprophyte in decaying organic material. Tyzzer explained the cause of botulism in range cattle by way of an etiological chain composed of 6 elements, the removal of any one of which would prevent the occurrence of botulism under field conditions. 1. The presence of the toxicogenic saprophyte which produces the toxin during its multiplication in decaying organic matter. 2. The toxin. 3. The carcass material in which the saprophyte multiplies and in which the toxin is elaborated. 4. Craving or pica which induces animals to devour bones, osteophagia, or other putrid carcass material that they would normally avoid, and 5. Phosphorus-deficient vegetation growing in 6. Phosphorus-deficient soil. Clostridium botulinum comprises a metabolically diverse group of gram-positive bacilli that are anaerobic and form spores. They produce at least 8 neurotoxins that are pharmacologically similar but serologically distinct from each other. 8 types of C. Botulism, types A, B, C alpha and C beta, D, E, F and G, have been identified. Clostridium botulinum type C alpha produces C1, C2 and D toxins, and type C beta produces C2 toxin. The type of toxin produced is also determined by the specific phage with which the bacteria is infected. The production of botulinum toxins are not important for growth or the physiological well-being of the bacterium, as growth and toxin production can be manipulated independently of one another. The species Clostridium botulinum is additionally divided into 3 groups on the basis of cultural and serological characteristics. The first group consists of all the type A strains and the proteolytic strains of types B and F. The second includes strains of type E and the non-proteolytic, saccharolytic, strains of types B and F. The third group contains all non-proteolytic type C and D strains. A few strains of type C and D are mildly proteolytic but are nevertheless included in group 3. The strains of C. botulinum type G, as described by Gimenez, are metabolically distinct and the organism has been renamed Clostridium argentinense as a result of these metabolic and cultural differences. The 3 existing groups also differ in terms of their cell wall components, with implications in immunoprophylaxis of botulism. Group 1 proteolytic strains of type A, B and F are motile, have paratrichous flagella, and are straight to slightly curved rods from 2 to 10 microns in length and 0,5 to 2 microns wide when cultured in peptone yeast glucose broth. The spores are oval and subterminal. In certain media with inadequate nutrients, they may increase in length to 20 to 45 microns. The cells normally occur singly, and less often in pairs or short chains. They retain the gram stain very well, often only becoming gram-negative with the commencement of sporulation. Sporulation occurs readily on egg yolk agar plates after 2 days or on chopped meat agar slants incubated at 30 degrees Celsius for 1 week. It appears that the highly toxigenic strains of all types tend to form fewer spores than less toxigenic strains. Group 2 strains include all the non-proteolytic strains of types B, E and F. The cells are motile, straight rods 15,7 microns long and 0,8 to 1,6 microns wide, occurring singly or in pairs. Spores are oval and subterminal and cause the cell to swell. Sporulation occurs readily on broth and solid media, but the germination of spores in laboratory media is promoted by the addition of 0.1% starch, which binds the long-chain fatty acids capable of inhibiting spore germination. Clostridium botulinum type A spores are fully activated for germination by exposing them to a temperature of 80 degrees Celsius for 10 to 20 minutes. Group 3 bacteria grown on Proteus yeast peptone broth are straight rods, motile with paratrichous flagella, and with dimensions ranging between 3,0 to 22 times 0,5 to 2,4 microns. These cells occur singly or in pairs. The spores are oval and subterminal and cause swelling of the cell. With the exception of some strains of group 3 organisms, Clostridium botulinum is a strict anaerobe and even traces of oxygen in its environment inhibit its growth. These organisms are mesophiles and grow optimally at temperatures between 18 and 37 degrees Celsius, and within a pH range between 7,0 and 7,6. Some of the non-proteolytic strains grow at relatively low temperatures, 3 to 4 degrees Celsius, whereas the proteolytic strains do not grow below 10 degrees Celsius. The optimal temperature for toxin production is 25 to 30 degrees Celsius. Non-proteolytic strains do not grow below pH 5,0 to 5,2, whereas the proteolytic strains generally do not grow below pH 4,7, though type A has been shown to do so at pH 4,0. In pure culture, Clostridium botulinum grows well on solid agar media such as horse blood agar, liver veal egg yolk agar and anaerobic egg yolk agar, and in enriched, non-selective fluid media, including glucose peptone broth, reinforced clostridial medium, trypticase peptone glucose yeast extract trypsin broth, or Robertson's cooked meat medium. A selective medium, Clostridium botulinum isolation agar, containing cycloserine, sulfamethoxazole and trimethoprim as inhibitory agents, has been devised for the isolation of C. botulinum from human fecal material. Organic nutrient requirements for growth and toxin production of groups 1 and 2 strains differ. Botulinum neurotoxin refers to any one of 7 substances, namely toxin types A, B, C1, D, E, F and G, that are produced by Clostridium botulinum. The various toxins, which are proteins, have similar molecular weights and probably similar molecular structures. The 8th toxin, referred to as C2, is produced by type C and D strains but is not a neurotoxin. It is also referred to as the botulinum binary toxin, and has a unique structure and pharmacological action. It does not cause flaccid paralysis, but it does act as an adenosine diphosphate ribosylated enzyme, causing increased vascular permeability and necrosis in the epithelium and lamina propria of the duodenum and jejunum. The toxins are relatively resistant to the action of mild chemical agents, but are susceptible to heat inactivation. High salt concentrations prevent toxin production. The molecular mass of the neurotoxins produced by types A to F varies from 150,000 to 160,000 daltons. The toxins are synthesized as single polypeptide chains, but when released from the bacteria they are proteolytically cleaved to form 2 non-identical protein fragments, each consisting of a heavy chain or subunit with a molecular mass of 100,000 daltons and a light chain or subunit with a molecular mass of 50,000 daltons, linked by a disulfide bond. Type A and B neurotoxins contain at least one disulfide bond each, which on reduction causes loss of biological activity. However, botulinum toxin is moderately resistant to enzymic proteolysis under natural conditions but is inactivated by exposure to a temperature of 80 degrees Celsius for 10 minutes. The botulinum toxin is synthesized intracellularly and is released into the culture supernatant when bacteria undergo autolysis after completion of growth cycles. The concentration of free toxin may thus increase in the supernatant even after protein synthesis has stopped. It appears that botulinum neurotoxin may be synthesized as an inactive or less toxic precursor, which is then activated by selective cleavage by proteolytic enzymes. The ability of trypsin to activate botulinum neurotoxin has been demonstrated for types A to G. The potency of botulinum toxins, which may also be produced by bacteria grown on artificial media, is expressed as the lethal dose in 50% of animals, LD50, or minimum lethal dose MLD, in mice. Botulism in animals has been described in cattle, horses and foals, mules and donkeys, sheep and goats, pigs, water birds, turkeys, ostriches and ducks, and dogs. Among livestock, horses appear to be the most susceptible to the effects of the botulinum toxin. Amounts of toxin which are sublethal in mice can cause the death of adult horses if administered intravenously. Pigs and carnivores, on the other hand, are very resistant to botulinum toxin and for all practical purposes are not susceptible to its effects. Clostridium botulinum type C1 toxin may be present in the liver of healthy pigs infected with Clostridium botulinum type C without the pigs showing clinical signs. Cattle, sheep and goats appear to be equally susceptible to the effects of the toxin. There is an apparent geographic variation in the distribution of the different toxin types of Clostridium botulinum. Toxin type C and D appear to be the exclusive cause of botulism of livestock in countries in the southern hemisphere, in Australia, South Africa and certain South American countries, whereas type B is more often the cause of botulism in livestock in the USA and in Europe. Spores of Clostridium botulinum occur commonly in soil, water, marine sediments and marine environments throughout the world. Clostridium botulinum also appears to be a normal and innocuous inhabitant of the intestinal tract of horses, cattle and poultry where it multiplies and from which it is shed in large numbers in the feces for up to 8 weeks after primary infection. Outbreaks of botulism in livestock occur under a variety of conditions but can in general be subdivided into 2 main categories. First, associated with phosphorus deficiency and osteophagia, in which the disease occurs sporadically over a relatively long period of time in animals, mainly cattle, but also to a lesser extent sheep and goats, maintained under extensive ranching conditions, and secondly the form in cattle, sheep, goats and horses which is associated with the ingestion of toxic feed or water and which may result in the deaths of large numbers of animals over a short period of time. In sporadic outbreaks of botulism unassociated with oligophosphorosis, Clostridium botulinum containing carcass material of mammals or birds may contaminate feed or water of domestic livestock. More rarely, spoiled vegetable matter such as grass hay, lucerne hay, grass clippings, silage, brewer's grain and even kitchen waste of mine hostels, may serve as substrates for bacterial growth and toxin production. Chicken manure, especially broiler litter, which is often fed to ruminants as a supplement because of its high nitrogen content, frequently contains carcasses of dead chickens in which Clostridium botulinum has multiplied and produced its toxins. Outbreaks have even occurred following the spread of chicken manure on pastures as a fertilizer or when it has been used as bedding material. Based on experimental data, it appears that the type of feed that animals are receiving, as well as a change in feed prior to their exposure to botulinum toxin, affects the dose of the toxin required to induce the disease in a specific species. Probably the single most important factor responsible for botulism under extensive ranching conditions is the occurrence of osteophagia resulting from phosphorus-deficient grazing. Cattle, particularly, and sheep to a lesser extent, are prone to develop osteophagia as a result of phosphorus deficiency. Other species are not known to develop osteophagia. Economically serious outbreaks of botulism as a result of pica has been recorded in Africa, Australia and several South American countries. Pigs are highly resistant to the effects of the botulinum toxin. The only recorded outbreak of botulism in this species of animal occurred in Australia and followed the ingestion of dead fish containing type C toxin. Toxico-infectious botulism is a rare form of the disease in humans and animals which results when toxin is produced in vivo by C. botulinum growing in the body itself, rather than by the ingestion of toxin. It may either follow wound infections or occur after ingested spores have germinated and proliferated as vegetative forms in the gastrointestinal tract. Wound botulism has been described in humans and is becoming a problem in drug addicts who use contaminated hypodermic needles. Botulism in human infants is the result of the absorption of toxin elaborated by organisms, usually group 1 strains, following their colonization of the intestinal tract. A similar situation has been observed in pheasants, in which the crop was the site of colonization and toxin elaboration, as well as in broiler chickens, in which the cecum was the site of bacterial multiplication. A substantial quantity of botulinum toxin, which is ingested, is either not absorbed or is destroyed by digestive processes, including destructive processes by rumen bacteria in ruminants, so that the oral lethal dose is larger than the lethal dose of toxin administered or acquired by other routes. Small, non-lethal doses of toxin ingested over a period of time will also cause intoxication. The cumulative dose is, however, larger than that which induces botulism if it is received as a single dose. Animals may thus become poisoned by the ingestion of feed containing sublethal amounts of toxin if they are fed such material over a few successive days. The presence of complexing proteins of nucleotide sequences associated with the neurotoxin genes of serotypes A to F seems to allow absorption of the toxins from the intestinal tract. In the case of type Clostridium botulinum toxin, hemagglutinin are important in the absorption of the toxin from the small intestine. Following its absorption into the bloodstream, the botulinum toxin is disseminated throughout the body, but, with the exception of type C2, it only has a pharmacological effect on peripheral nerve endings whose neurotransmitter is acetylcholine, somatic motor nerves supplying skeletal muscles and efferent parasympathetic nerves. The central nervous system is protected by the blood-brain barrier. The flaccid paralysis caused by the toxin develops as a result of the inhibition of the release of acetylcholine at the neuromuscular junctions, with the result that no stimulus reaches the motor end plates. The toxic effect of botulinum toxin is exerted by the dual action of its large subunit, which carries the ligand and is responsible for the fixation of the toxin molecule to a specific tissue receptor on the terminal unmyelinated portions of nerve membranes, and the small subunit, a zinc endopeptidase possessing the pharmacological activity. Following the binding of botulinum toxin to tissue receptors, it is internalized into the axoplasm where it displays its zinc endopeptidase, or endoprotease, activity targeting the protein components of the neuroexocytosis apparatus. The various types of botulinum toxin target different proteins in this apparatus. Types B, D, F and G specifically cleave VAMP/synaptobrevin in the synaptic vessel membrane. The A and E neurotoxins specifically cleave SNAP25, a protein of the presynaptic membrane, and type C cleaves syntaxine, also a component of the nerve plasma lemma, probably with the aid of accessory factors. Each of the enzymes that target a specific molecule cleaves the molecule at a site that is specific and different for the individual toxin. A progressively developing flaccid paralysis results, paralysis of the muscles of respiration being the eventual cause of death. Although toxin binds rapidly and irreversibly to tissue receptors, it does not immediately cause paralysis. Botulism toxin type C2 causes selective loss of non-muscle F actin. It appears that the effect on actin, that supports the endothelial cell membrane configuration and integrity, is, at least in the lungs, to disrupt the intimal barrier function of endothelial cells. Clinical signs in cattle exposed to type B toxin appear to differ from those caused by the C and D toxins and are associated with paralysis of the cervical portion of the esophagus. It would seem that this effect results because smaller amounts of acetylcholine are secreted by the nerve endings of the parasympathetic nerves, which innervate the affected portion of the esophagus. This has led to the suggestion that if cattle are exposed to relatively small amounts of toxin, the parasympathetic motor end plates are selectively affected because of their smaller reserves of acetylcholine. The chronic effects of botulism toxin are comparable to surgical denervation, and complete recovery depends on the formation of new neuromuscular junctions. The clinical signs caused by intoxication with type C and D in cattle vary considerably and depend on the quantity of toxin that has been ingested. The disease are divided into peracute, acute, subacute and chronic evolutive clinic forms based upon the onset, the sequence of development of paralysis in different muscle groups and severity of the clinical signs. Range cattle suffering from phosphorus deficiency that contract botulism by ingesting toxic material lying in pastures, most commonly develop the subacute to chronic form of the disease. A few may even be so mildly affected that they escape notice. More acute forms are rare under such circumstances, but they do occur. A feature of botulism which, apart from anything else, is of diagnostic significance, is that the case fatality rate is invariably high. Most affected animals will die, but if an animal does recover, it is most likely to have suffered from subacute or chronic disease. In sporadic outbreaks unassociated with osteophagia, such as those following the ingestion of a toxic batch of hay or kitchen refuse, new clinical cases are detected over a period of days. At the beginning of an outbreak, cattle usually die acutely, but as the outbreak progresses, the duration of clinical signs tends to increase, until at the end of the outbreak a few lightly affected animals may even recover fully. The incubation period in experimental cases varies from about 18 hours to 16 days, but in natural disease in cattle it usually varies from 2 to 6 days, but deaths may occur for up to 17 days after animals have had access to toxic feed. The duration of illness may be directly correlated with the length of the incubation period. It may be as short as 24 hours in peracute cases, and up to 7 days or longer in more chronic cases. There is also an intermittent form of botulism in which generally mild clinical signs are manifested at intervals of a few days with periods of remission. Affected animals are afebrile and typically manifest partial or complete flaccid paralysis of the muscles of locomotion, mastication and deglutition. The paresis, which progresses to paralysis, usually commences in the hindquarters and then spreads progressively forwards, affecting in turn the forelimbs, the neck and head, the rapidity of succession decreasing from the peracute to the chronic cases. Sensory perception and reflex actions of the eyes are maintained for a considerable time after skeletal muscular paralysis has set in, and animals generally appear mentally alert. Hypersensitivity and what may be perceived as aggressiveness may occasionally be manifested. In some cases, which are considered to be atypical, the muscles of mastication and deglutition, but not those of the locomotor system, are paralyzed. The appetite is mostly unaffected. Animals will prehend and masticate food for as long as they are able. A few animals may be constipated or, more exceptionally, suffer from diarrhea. Ruminal tympany often develops in animals that lie in awkward positions in the terminal stage of the disease. The naturally acquired, peracute disease is seldom encountered. Some animals suffering from it may die suddenly without clinical signs having been noticed. In this form, paralysis of the muscles of locomotion, mastication and deglutition is usually marked, and affected animals soon become prostrate and are more or less completely paralyzed. As progresses, they assume a sternal lying position, frequently with the neck turned back and the head resting on the flank. In the later stages they become laterally recumbent. Chewing and swallowing movements are seldom possible. The tongue often protrudes from the mouth. the lower jaw is slack and there is profuse salivation. In acute evolution, the clinical signs generally resemble those of the peracute disease, but the course of the disease is more protracted. Although most animals lie down during the initial stages of the disease, others are able to remain standing. At first, affected animals are able to rise without assistance and, when disturbed, move about sluggishly and with a stiff gait. As the disease progresses, they are unable to rise voluntarily, and even when lifted to their feet, they are seldom able to remain standing when all support is removed, and usually drop down helplessly. Initially the head is held upright, but in the later stages the neck is doubled back with the head resting on the flank. However, if the head is manually raised, it drops back involuntarily towards the flank when released. Impairment of the muscles of mastication and deglutition is usually pronounced, causing boluses of grass to accumulate in the back of the mouth. Paresis and paralysis of the tongue also set in at this stage. In the latter instance, the tip of the tongue either lies on the incisors or protrudes from the mouth. In some cases, paralysis of the tongue is not complete and the animal may still be able to retract it into the mouth after it has been physically extracted. In these cases, the mouth can be manually opened with relative ease. In addition, if, when examining a suspected case, the clinician stands behind the head of the animal to one side of the neck, grasps the horns or ears firmly in both hands and shakes the head of the animal vigorously, the slack lower jaw meeting the upper jaw often causes a rather characteristic plop sound to be emitted. Some degree of paresis, or paralysis of the tail, is also usually evident. In the subacute disease, the clinical signs differ from those of acute form only in degree and in the period required for their evolution. Affected animals walk with a stiff, sluggish gait, and usually prefer to lie down. As the disease progresses, it becomes more and more difficult for them to rise voluntarily, and when complete paralysis has set in, rising is no longer possible. The duration of the clinical signs in chronic evolution is longer than 7 days. In the early stages, affected animals usually eat well, but they generally appear tucked up and have staring coats. Swallowing and chewing are not always affected. Paralysis of the legs develops to a variable extent, and although animals prefer to lie down, they generally are able to rise without assistance. There is rapid loss of condition. The severity of the clinical signs progresses until prostration and, in most cases, death supervene. The signs in cattle affected by type B toxin generally develop within 3 days of their being exposed to toxic material, usually brewer's grain or grass silage. These differ markedly from those caused by type C and D toxin. In general, the disease is characterized by anorexia, profuse salivation, regurgitation of feed and water following their ingestion, and dehydration. The animals manifest a decreased tonus of skeletal muscles, but they are not ataxic, nor is the tail or the tongue paralyzed. The initial signs are associated with reduced appetite, reduction in milk production, and a decrease in the consistency of the feces, which sometimes progresses to a frank diarrhea. Pronounced salivation and regurgitation of feed and water are the main characteristics of this type of intoxication, the latter often resulting in inhalation of the regurgitated material and the development of a foreign body pneumonia. Severely affected animals usually die, while those that are mildly affected recover uneventfully after a period which may be as long as 3 to 6 weeks. In sheep and goats, the clinical signs are similar to those in cattle, except that the muscles of mastication and swallowing are not as obviously affected. In peracute cases, animals may die without signs having been observed or within 4 hours of their commencement. Affected sheep are listless, show muscular incoordination, weakness of neck muscles and torticollis, walk with a wobbly gait, are disinclined to drink water, and, infrequently, salivate excessively. When driven, they lag behind the rest of the flock. Characteristic features are that sheep and goats develop an arched back with a drooping tail, head and neck, and manifest an abdominal type of respiration and frequent urination, while sheep often, but not invariably, show a fine trembling of the tail stump. If an affected sheep is grasped by the ears and the head shaken up or down, as in cattle, the lower jaw may strike the upper jaw to emit a clapping sound. Respiratory distress may be evident. The prognosis for the disease is extremely poor, but a few may recover without specific antiserum treatment. In adult horses and foals, a similar neuromuscular paralytic syndrome is evident in those animals suffering from the toxi infectious syndrome caused by type B toxin. This disease, referred to in foals as the Shaker-Foal syndrome, occurs sporadically, most frequently in animals between 2 and 4 weeks of age, although adult animals are as susceptible to the effects of the toxin. Some foals may be found dead without having been noticed to be sick, while others live for 24 to 40 hours before they die. They are often found in the prone position and are unable to rise. When assisted to their feet, they may remain standing for a few minutes and walk with a stiff, stilted gait, only to fall to the ground again after manifesting severe trembling of the muscles of the legs. When down, they are alert and the muscle tremors cease. As the disease progresses, they are only able to stand for very short periods, but eventually cannot do so at all even when assisted. Affected foals also have difficulty in swallowing, with the result that they eat with difficulty and milk may run out of the sides of their mouths while they are suckling. They periodically attempt to urinate but void only small amounts, and usually become constipated. The pupils of the eyes are dilated and the pupillary light reflex is decreased. Respiratory distress becomes pronounced and breathing becomes abdominal in type, and there is an increased heart rate. The temperature of the affected animals remains normal during the course of the disease. The mortality rate is usually in excess of 90%, and in non-fatal cases or those in which treatment is effective, it may take up to 3 weeks for the muscular weakness to disappear. In foals that survive for a number of days, signs of an aspiration pneumonia may develop. The clinical signs in adult horses affected by type B toxin are similar to those in foals. Affected horses are initially lethargic, and have a stilted gait, after which the typical signs develop within a matter of 6 to 8 hours. Animals that become recumbent cannot retain a position of sternal recumbency, due to the profound weakness caused by the flaccid paralysis. With certain exceptions, clinical signs in horses affected by type C toxin are similar to those in horses suffering from type B intoxication. Animals become ill within 3 days of ingesting feed containing type C toxin. Most die within 48 to 72 hours, the mortality rate being in excess of 80%. The initial signs of intoxication, which may precede the development of overt clinical signs by 24 hours, are mild and characterized by an asymmetric decrease in palpebral tone. As the condition progresses, horses intermittently stand with slight carpal flexion, while muscle fasciculations may be palpated in the triceps area. They retain their appetite during the course of the intoxication and, contrary to animals suffering from the effects of type B toxin, have no difficulty in swallowing. They do become constipated, however. Within 24 hours, these signs develop into severe muscular tremors of the fore and hind legs. Restlessness manifested by the horses striking the ground with their forelegs and lying down for short periods is apparent. Muscle tremors disappear after the animals have been in the prone position for a short period, and it may erroneously be assumed that they have recovered. As the intoxication progresses, affected animals become sternal recumbent and lie with the neck extended and the muzzle resting on the ground. Terminally, horses assume a position of lateral recumbency while paddling their legs rhythmically. Mydriasis and slow pupillary light reflexes are seen in few of the affected animals. There are no macroscopic or microscopic lesions that can be regarded as characteristic of, or specific for botulism. There may be a catarrhal enteritis and petechiae in the small intestines and the endocardium. Chronically affected animals are constipated and manifest signs of ruminal and colonic stasis and fatty changes in the liver. Excess pericardial fluid and pulmonary edema may also be present. In sheep that have died as a consequence of type C and D intoxication, extracardiac macroscopic lesions may be so extensive that their occurrence is suggestive of a heart failure syndrome. These lesions include mild to moderate accumulations of transudate in the body cavities, marked pulmonary edema and congestion, the presence of thick white foam in the trachea, multiple epicardial petechiae and ecchymosis, myocardial pallor of the inner half of the ventricular walls, mild swelling of the liver and nephrosis. Foreign bodies reflecting the existence of pica, such as bones, tortoise shell, bits of wood, stones, and pieces of iron, may be found in the rumen or reticulum in animals on veldt grazing. However, no indications of pica will be evident in animals in which the toxin is ingested in prepared feed or water. At necropsy, the carcasses of horses that have died of toxico-infectious botulism contain few characteristic lesions. The presence of excess pericardial fluid containing variable amounts of fibrin strands is a consistent finding. Focal areas of necrosis or abscesses may occur in the liver, navel, lungs, skin or muscles. In many cases gastric ulcers are present at the margoplicatus and occasionally at the pylorus. In addition, severe pulmonary edema, intestinal stasis, and distension of the urinary bladder are present. The presence of extensive, intermuscular edema in the neck region, suspected to be by cause type C2 toxin ingested concurrently with type C1 toxin, has been reported in horses that died of botulism. In some animals the edema may extend caudally as far as the lumbar region. Botulism is often difficult to diagnose. A suspicion diagnosis is made on the basis of the history, clinical signs and negative postmortem examination. Factors in the history of the outbreak which support a diagnosis of botulism are lack of or inadequate immunization against botulism and, in the case of range animals, the presence of osteophagia. The possibility of other diseases causing similar clinical signs to those of botulism should be systematically excluded. A useful diagnostic is that the number of cases diminishes drastically in affected herds or flocks following administration of primary and secondary doses of vaccine within a month of each other. In addition, the response of sick animals to botulism antiserum therapy may also be of some assistance. A confirmation diagnosis of botulism is dependent on the demonstration of botulinum toxin in specimens taken from diseased animals or those that have died, and in the suspected source of the toxin if this is still available. Although determining the presence of botulinum toxin in specimens submitted for the purpose is the most reliable way to confirm a diagnosis, many of the available test systems lack sensitivity and it is often very difficult to confirm the diagnosis of botulism. Specimens collected for the diagnosis of botulism in live animals should consist of serum and feces. Specimens, 5 to 20 milliliters, should be taken of the rumen content and the contents of the small and large intestines from dead ruminants. In horses, specimens of the cecal contents, as from any necrotic lesion present in the gastrointestinal tract are required. From all animal species 5 to 20 milliliters of serum and pericardial, thoracic and peritoneal transudates should be submitted. If available, specimens from several animals should be collected. Specimens of what is suspected to be the source of the toxin, such as feed concentrate, grass, silage, carcasses or parts of carrion, drinking water, mud or soil should also be submitted. Since the toxin is often unevenly distributed in feed, representative samples for analysis should be taken from various portions of it. After being collected and packed in sealed containers, the specimens should be deep frozen if possible. Specimens cannot be frozen, they should at least be kept refrigerated and submitted packed in ice to a laboratory. Isolation of the bacterium from the intestinal tract provides equivocal results, since these bacteria may also be isolated from healthy animals. The specimens, feed and tissues such as liver or intestinal lesions, for the isolation of the organism, should first be inoculated in cooked meat broth, and trypticase peptone glucose yeast extract broth with trypsin, and incubated under anaerobic conditions, at 26 and 35 degrees Celsius for 5 days. After this initial incubation period, if no growth is observed, the cultures should be incubated for a further 5 days. Subcultures should be examined to determine the type of organism and toxin according to published methodology. Bioassay are used to determine the presence of botulinum toxin in tissue and feed specimens. The toxin is extracted in a gelatin phosphate buffer solution, which is divided into at least 4 separate portions, each being subjected to different treatments consisting of heat, the addition of trypsin or polyvalent or monovalent Clostridium botulinum antiserum. An amount of 0,5 to 1 milliliter of each portion is injected intraperitoneally into at least 2 mice, which are then observed for up to 10 days for signs of botulism. Serum collected from horses affected with toxi-infectious botulism invariably tests negatively, since the concentration of toxin in the serum is generally so low that the toxin cannot be detected by conventional methods. The toxicity of feed samples may also be determined by test feeding the sample to specifically immunized and unimmunized cattle, sheep or laboratory animals. Enzyme-linked immunosorbent assay was used to detect antibodies against toxin types C and D and sera obtained from unvaccinated cattle suspected to be suffering from botulism. Other methods for the detection of the presence of the botulinum toxin in various types of specimens include an immunodiffusion method, radioimmunoassay, various immunochemical assays, and the temperature-induced microcomplement fixation test. Except for the microcomplement fixation test, which is highly sensitive, the sensitivity of these other tests does not exceed that of mouse bioassay. The two most important differential diagnoses for botulism are mycotoxicosis and plant poisoning. In the latter, the clinical signs of paralysis, salivation, retention of food in the pharynx and the typical posture, and the lack of specific macro and histopathological changes render the two conditions indistinguishable. In horses, other important differential diagnoses that may be considered include polioencephalomalacia and conditions associated with hypocalcemia and hypomagnesemia, nutritional or plant toxin-induced myopathies such as ionophore poisoning and poisoning with plants. In cattle, ingestion of the toxin of the fungus Aspergillus clavitis, organophosphate and lead poisoning. Infectious diseases such as rabies, listeriosis, bovine ephemeral fever, sporadic bovine encephalomyelitis, thrombotic meningoencephalitis, cerebral babesiosis and cerebral theileriosis, as well as nonspecific bacterial meningitis and encephalitides, may also mimic some of the clinical signs of botulism. In sheep, the possibility of tick paralysis caused either by Ixodes rubicundus or Rhipicephalus evertsi, focal symmetrical encephalomalacia, twin lamb disease and Cohen-Urus cerebralis infection should also be considered. In the case of tick paralysis, removal of the ticks is followed by recovery from the paralysis. In horses, infection with equine herpes virus 1, and various viral encephalitis, should be considered. There is no specific treatment of diseased animals suffering from botulism, apart from the administration of hyperimmune serum specific for the toxin type involved, which may assist in the recovery of animals still in the early stages of the disease. The anti-serum should be prepared and standardized according to international convention. As the anti-sera are animals, they are generally used selectively for the treatment of valuable stock. The commercially available anti-sera contain a minimum of 1,000 international units per milliliter, and are prepared from hyperimmunized horses. Cattle and horses are treated with 5 ml each of type C and D anti-serum intravenously, sheep with 1 to 2 ml of each type, and poultry and other bird species with 0,5 ml type C intravenously. This treatment may be repeated within 24 hours. Response to treatment varies. In some animals, beneficial effects may occur within minutes, while in others this only occurs after 5 days. Sometimes no beneficial effects become evident. The possibility of the development of anaphylactic shock in animals that are receiving antiserum therapy is significant and should be anticipated. The use of antiserum in horses has been shown to reduce mortality rates from 80 to 30%. In horses suffering from type C intoxication, treatment with a specific antiserum will improve the prognosis if it is instituted early in the course of the disease, before they become recumbent. Following the administration of a 5-day course of the antitoxin, 1 or 2 relapses may occur, often at intervals of 5 to 8 days, after which the treatment regimen should be repeated. Horses that survive often develop a severe atrophy of the suprascapular and the gluteal muscles, which becomes apparent when the neurological signs of the disease have disappeared, and may persist for up to 5 months. Good nursing is essential when treating animals suffering from botulism. Dehydration, if present, should be corrected, but it must always be borne in mind that the muscles of deglutination may be affected, and great care must be exercised when administering fluids by the oral route in order to prevent the possible development of dosing pneumonia. In both cattle and sheep, acid-base imbalance often occurs and should be corrected. The administration of a mild laxative to horses may be indicated in order to evacuate the colon and prevent impaction. Recumbent animals may require some sort of support system that will keep them in a position of sternal recumbency. This is particularly important in ruminants in order to prevent the formation of ruminal tympany. The prevention of the form of botulism in range cattle predisposed to osteophagia is three-pronged: vaccination, correction of the phosphorus deficiency and removal of the source of the intoxication, e.g., carcass debris, when this is practically feasible. Vaccination against botulism are effectively used in world. Commercially produced vaccines are available. They contain toxoids of type C and D which are adsorbed onto aluminum hydroxide gel in order to enhance their immunogenicity. The initial vaccination administration should be followed by a second one 4 to 7 weeks later. Thereafter it is given as an annual booster, timed, if possible, to precede the commencement of the season in which botulism is most prevalent. As botulism in animals is not always an easy disease to diagnose or to confirm by laboratory means, particularly in the early stages of an outbreak, it is often advisable to recommend that all the animals in the group containing suspected cases be vaccinated as soon as possible. Correction of phosphorus deficiency in cattle is essential in areas where botulism in range animals occurs and, apart from the role it plays in reducing the prevalence of the disease, it has many other beneficial effects, including increased productivity. There are several methods of administering additional phosphorus to animals, the most frequently used being licks containing phosphate or bone meal or the addition of phosphates, in the correct formulation, to drinking water. The removal of the sources of the intoxication and making them unavailable to animals also helps to reduce the prevalence of botulism. Where cattle are maintained under extensive systems of management are concerned, the source is usually carcass debris. It is perhaps not always practically feasible to remove all of it from large properties, but attempts should be made to remove as much of it as possible. If this is not done, it may be found that nevertheless, outbreaks of botulism on a property are self-perpetuating. Possible sources of the toxin should be destroyed, buried deeply or placed so that they are unavailable to cattle. If buried or placed in, for example, a wired-off enclosure, it should be remembered that dogs or wild animals, such as hyenas, may dig them up or drag them away to make them available to the cattle once again. It is imperative that ruminants be vaccinated against botulism before they are fed poultry litter for the first time. Thereafter they should be immunized regularly. Nevertheless, it is still essential that ruminants receiving it be adequately protected against botulism by immunization. Other methods for the control of botulism, particularly that which occurs in sporadic outbreak form, consist of, for example, the prevention of contamination of hay silage and drinking water. Spoiled hay or other feedstuffs, or those contaminated by the carcasses of small animals, should not be fed to animals. When silage is prepared, attention should be paid to attaining the correct pH. No production of botulism toxin occurs at a pH of less than 5,3 and where the water activity is less than 0,94. Foals suckled by dams vaccinated against botulism are protected by passive, colostrum-derived immunity during the period in which they are most likely to contract toxi-infectious botulism. It is recommended that mares be vaccinated, taking cognizance of the toxin type most likely to be involved, on 2 occasions at an interval of 6 weeks, the second being administered 2 to 4 weeks before parturition. Histotoxic clostridial diseases. The members of this ubiquitous group of bacteria, which are individually discussed in Clostridium shovii, Clostridium novii, Clostridium septicum and other clostridial infection, most commonly cause gas gangrene or malignant edema and less often a number of other syndromes in livestock. In rare instances, Clostridia not contained within this group of organisms, such as Clostridium perfringens types A and C, may also be associated with gas gangrene as a consequence of wound infection. The Clostridium spp. Included in this group occur commonly in soil, sewage, marine sediments, and decaying animal and vegetable material. They are obligate anaerobes, will produce enzymes as saccharolytic and proteolytic, and most are also capable of lowering the redox potential of the medium in which they grow, thus creating a suitable environment for continuing growth. They produce a variety of major and minor toxins in various combinations, the in vitro and in vivo action of some of which are poorly understood despite the fact that most have been characterized chemically and biochemically. The diseases caused by infections with these bacteria are characteristically rapid in onset, and are highly fatal primarily due to severe toxemia caused by both the products they elaborate and those which arise following tissue breakdown. They usually occur sporadically, often affecting single or small groups of animals, and most may be effectively controlled by immunization. Wound infection which progresses to malignant edema or gas gangrene may result from infections with any one or a combination of the Clostridia in this group and is commonly the consequence of contamination of traumatic lesions in the skin. Gangrenous lesions may also occur in genital or gastrointestinal tracts following infection of wounds with some of the Clostridia species that belong to the group. There are exceptions to the foregoing, however, examples of which are those diseases that arise as a consequence of dormant infections such as blackwater in cattle in which the lesions are usually localized in the larger striated muscle groups, black disease and bacillary hemoglobinuria where the primary lesions are necrotic foci in the liver, braxy in which the primary lesions occur in the abomasum, and necrotic enteritis of foals caused by Clostridium difficile. In most cases of wound infection, the lesions are restricted to the subcutaneous tissues and are seen as extensive gelatinous inflammatory infiltrates which may be virtually colorless, yellowish-brown or red tinged due to the presence of concurrent hemorrhage. The exudate may on occasion contain varying numbers of gas bubbles, which impart an unpleasant odor to it. In some infections, such as those by Clostridium sordelii, the odor is particularly foul, and in the case of blackwater in cattle it resembles that of rancid butter. A synthesis of the main clostridial diseases, caused to the different species of animals. Blackwater in cattle arises as a consequence of the activation of spores of Clostridium shovii latent in the musculature. Clostridium shovii may also cause gas gangrene in cattle, sheep, and goats, and rarely in horses and pigs following wound infection. These infections cause a peracute or acute, usually fatal, non-contagious disease which is characterized by focal, gangrenous myositis and associated localized cellulitis. Death is caused by the local and systemic effects of the toxins elaborated by Clostridium shovii. Use of the term blackwater is restricted to that condition in cattle which arises as a result of endogenous Clostridium shovii infection, whereas the lesions that develop as a consequence of wound infections by this organism in various animal species, including cattle, are referred to as gas gangrene. Blackwater is a worldwide disease of cattle. It was recognized as a distinct disease in 1782 by Chabert, who named it charbon symptomatic and distinguished it from anthrax, with which it was often confused. Despite of the effective vaccines available today, sporadic outbreaks and individual cases of the disease are still regularly encountered in livestock all over the world, and blackwater remains one of the important bacterial diseases of cattle under 3 years of age, particularly those in feedlots. For this reason, cattle should be regularly immunized against this infection. Clostridium shovii is a gram-positive anaerobic rod, 3 to 8 microns long and 0,5 to 1 microns wide. When grown in fluid media, the organisms are most commonly found as single cells, but sometimes occur in pairs and, rarely, in short chains. The cells are motile and have paratrichous flagella. In older cultures they are pleomorphic, showing irregular staining. Citron, barred and spindle shapes occur frequently. Spores, formed when the organism is cultured on solid media and in broth, are oval, occur in central or subterminal positions, and distort the shape of the cell. They are resistant to the effects of being boiled in water as well as to phenolic and quaternary disinfectants at concentrations used to sterilize contaminated instruments. Clostridium shovii grows well in peptone yeast glucose broth, in which, after 4 days of incubation, the pH decreases to 5,0 to 5,4. The optimum temperature for growth is 37 degrees Celsius. Poor growth is obtained at between 25 and 30 degrees Celsius, but no growth occurs at 45 degrees Celsius. The addition of liver extract to the medium will favorize growth, which is also stimulated by fermentable carbohydrates. Growth is inhibited by concentrations of NaCl above 6.5% as well as by bile levels of 20% or higher. pH values of 8,5 or higher also inhibit growth. Surface colonies on blood agar are circular, 0,5 to 3 mm in diameter, hemolytic, slightly raised or low convex, whitish-gray, translucent or opaque, and granular with a glossy surface and an entire margin. Red blood cells of cattle, sheep, pigs, rabbits and dogs are readily hemolyzed by Clostridium shovii on blood agar, whilst those of guinea pigs, horses, humans, and chickens are more resistant. Clostridium shovii has fastidious anaerobic growth requirements. It is saccharolytic, non-proteolytic and does not produce lecithinase and lipase. Lactose, galactose, mannose, glucose, maltose and sucrose are fermented, esculin is hydrolyzed by 90 to 100% of strains, and ribose by 40 to 60% of strains, while nitrate is reduced by 61 to 89% of strains. No starch is hydrolyzed or is acid produced from amygdalin, arabinose, celebiose, fructose, glycogen, inositol, mannitol, melazetose, molybbiose, raffinose, rhamnose, salicin, sorbitol, starch, trehalose and xylose. Meat is not digested by 90 to 100% of strains. Large volumes of gas, carbon dioxide and hydrogen, are produced in liquid media. The organism has a high demand for cysteine, biotin, nicotinic acid, pantothenic acid, pyridoxamine, thiamine and para-aminobenzoic acid. Clostridium shovii produces protein toxins and other protective antigens in amounts which vary with the strain. Both bacteria and the filtrate of fluid media in which they have been grown are immunogenic. Whole cultures of Clostridium shovii are more immunogenic than washed bacterial cells alone. Immunization with formalinized whole cultures will produce high levels of protective immunity, which are probably induced by the heat label protective antigen that occurs in the cell wall of the organism. The alpha toxin produced by the bacterium is lethal, necrotizing, and hemolytic. The beta toxin behaves as a deoxyribonuclease, the gamma toxin is a hyaluronidase, and the delta toxin is an oxygen label hemolysin. However, the role of these toxins in the pathogenesis of Blackwater is poorly defined. Alpha toxin is formed as part of a soluble immunogenic complex from which it dissociates spontaneously, and has a molecular mass of 27,000 daltons. Beta toxin is produced in an active form and is relatively heat stable, being able to withstand exposure to a temperature of 95 degrees Celsius for 10 minutes without appreciable loss of activity. The oxygen label hemolysin, delta toxin, is serologically related but not identical to streptolysin O. Clostridium perfringens theta toxin, tetanolysin and the hemolysin produced by some of the other Clostridia. Failure of some commercial Clostridium shovii vaccines to protect cattle, during outbreaks of Blackwater, has led to the belief that cross-protection between different strains may not be absolute. Blackwater occurs throughout the world in association with livestock and is primarily a disease of cattle and to a lesser extent of sheep. Goats, pigs, horses, camels, deer and mink are only very rarely affected, while birds, dogs, cats, rabbits and humans are resistant to infection with Clostridium shovii. Outbreaks of Blackwater tend to be seasonal. They occur most commonly during summer and autumn, especially after heavy rains. There appears to be a direct relationship between the prevalence of Blackwater and rainfall. The higher the rainfall, the greater the number of outbreaks during a season. Distribution of outbreaks is often regional and patchy, and its prevalence in some localities, which may be portions of one farm, may be high while adjoining areas are apparently free from infection. It appears that regional differences in the soil composition play a role in determining the survival of the bacteria in the areas of high prevalence. The mode of infection in Blackwater has not yet been accurately established. It is generally believed that infection follows ingestion of spores from the soil or in contaminated drinking water, particularly during the period when the eruption of permanent teeth takes place. The ingested spores, or those that have formed after vegetative bacteria have germinated and sporulated in the gut lumen, cross the intestinal epithelium and enter the blood and lymph streams to be distributed in tissues and organs throughout the body, including the musculature, in which they can remain dormant, probably in phagocytic cells, for prolonged periods. Though the spores of C. shovii are highly resistant to environmental conditions and remain viable for a number of years outside the body, there is no experimental evidence that these organisms actually multiply in the soil. C. shovii apparently does not live as a saprophyte. The main habitat of C. shovii is the animal body, and it may be isolated from the intestinal contents. Contamination of vegetation and water by feces containing the spores of the bacterium ensures animal-to-animal passage. Infected carcasses of animals that have died of the disease, however, appear to be the main source of the bacteria by contaminating the surroundings such as stables, sheds, kraals, pastures and drinking pools, which then become reservoirs of infection. Shearing sheds usually become contaminated by spores when animals that have died from Blackwater or gas gangrene caused by C. shovii are skinned in them. Once an area is contaminated, spores persist for years. Direct transmission from animal to animal does not occur. In cattle, Blackwater is mainly confined to young stock between the ages of 9 months and 2 years. Rapidly growing animals in good condition and on a high plane of nutrition are more susceptible to the disease than underfed animals or those in poor condition. Exercise, cold and heat do not appear to influence animal susceptibility to Blackwater. Cattle, sheep, goats, horses and pigs of all ages may suffer from localized gas gangrene following the infection by Clostridium shovii of wounds contracted, for example, during shearing, dipping, parturition, and castration or tail docking operations, or of the umbilicus in newborn animals. Wound infection of vaccination sites, particularly those induced by vaccines containing an irritant substance, as saponin, may precipitate blackwater within a matter of 2 hours. Goats are much more resistant than sheep to infection, and only isolated cases of gas gangrene have been recorded in pigs. The pathogenesis of Clostridium shoviae infections, blackwater in cattle develops when latent spores within larger muscle groups will germinate in anaerobic conditions and multiply when these muscles are traumatized, resulting in localized areas of low redox potential hematoma. The vegetative cells grow, ferment muscle glycogen, digest protein, and produce exotoxins and gas. The alpha, beta, delta and gamma toxins of Clostridium shoviae are produced and released into the tissues, resulting in muscle necrosis. The lesions, which usually remain localized and in most animals are situated in one of the large muscle groups, expand along fascial planes, but bacteremia also develops, particularly terminally. Occasionally, latent spores in the myocardium are stimulated to germinate and multiply with the production of typical lesions in the myocardium, the stimulus to germinate possibly being the consequence of changes in the myocardium caused by increased blood levels of cortisol and catecholamines as a response to stress. The latter form of the disease that is sometimes referred to as the visceral form of blackwater in contrast to the classical form that is much more common and easily diagnosed. The exotoxins and certain metabolites produced by the bacteria during their multiplication and those which arise from tissue damage, are absorbed from the affected muscles into the systemic circulation, causing toxemia and death. As the course of blackwater is so rapid, generally being less than 24 hours, clinical signs are not often observed in affected animals prior to death. Most affected cattle do not recover, but a small proportion of sheep and other animals that contracted the disease due to wound infection may survive the infection. In cattle, the first clinical signs are a rise of the body temperature, loss of appetite, ruminal stasis, and if the primary lesion is situated in one of the larger muscle groups of a limb, as is most often the case, there is initial stiffness followed by lameness which rapidly progresses in severity in the limb concerned. The muscles or muscle groups most commonly affected are those situated in the shoulder, buttock or loin regions, but those in the chest and neck regions and, more rarely, muscles such as the intrinsic and extrinsic muscles of the tongue, and the diaphragmatic and sublumbar muscles or myocardium may be primarily involved. The clinical signs, in the few cases in which they are evident, therefore vary according to the site of the lesions. If the muscles affected are superficial, there is subcutaneous swelling and crepitation at the site. The swelling increases rapidly in severity and size, and initially is hot and painful but terminally becomes cold and painless. Lesions situated in deeper body sites are not clinically detectable. Rarely, lesions may develop simultaneously in more than one location. Affected animals soon become recumbent, and manifest signs of dyspnea and accelerated pulse rates. The clinical signs of visceral blackwater are very similar to those of the classical form. Affected animals are depressed, reluctant to move, stiff and become recumbent. The clinical signs of localized gas gangrene that develop following wound infection by Clostridium shoviae are very similar to those of blackwater and are also dependent on the site of the infection. In sheep and occasionally in cattle and goats, the vagina, cervix and the uterus may be infected following parturition. In such cases the perineal and adjacent tissues are severely swollen and emphysematous, and blood-stained droplets of serous fluid may ooze from the surface of the affected parts. In the case of contaminated injection sites, lesions are localized to the site of injection, and are edematous and crepitant. This localized reaction expands rapidly, causing swelling of the tissues and the exudation of drops of blood-stained serous fluid through the skin, the exudate having a rancid smell. Affected animals may die within 18 hours of being injected with a contaminated needle. The course of the infection in pigs is usually less acute, the infection being localized. Localized gas gangrene as a consequence of wound infection with Clostridium shoviae rarely occurs in horses. However, in cases in which this does occur, the infection may spread and involve large areas adjacent to the initial lesion. Affected horses either die without being seen to be ill, or are severely ill, in which case they manifest depression, signs of shock, and an unwillingness to move the affected part, if it is in a limb or the neck. The swelling, which is initially hot and painful, becomes cold, edematous and crepitant. Most affected horses die, but in those that do recover following intensive antibiotic treatment, the affected tissues may slough, leaving large cavities a few centimeters deep which heal slowly. Clinical pathological changes in animals suffering from blackwater are not characteristic. Elevated levels of enzymes associated with muscle damage such as creatine kinase may be detectable, while the results of hemograms are indicative of toxic shock. The carcasses of animals that have died of blackwater undergo rapid putrefaction and bloat, and blood-stained, frothy fluid may ooze from the nose and anus. When the lesions are localized in a hind limb, that limb may be extended at an awkward angle. The subcutaneous, intermuscular and other interstitial tissues in the vicinity of the affected musculature are distended by a yellow edematous fluid which may be partially blood-stained and contain bubbles of gas. On cutting into an affected muscle, a reddish fluid exudes and there is a characteristic sweetish smell which resembles that of rancid butter. Lesions in muscles are characteristically well circumscribed, spongy due to the accumulation of gas bubbles between muscle fibers, friable, and either uniformly dark red or have alternating streaks varying in color from a mottled grayish red to pale yellowish or blackish. Affected muscles tend to be dryish towards the center of the lesions. The spleen is usually not enlarged, but regional lymph nodes are hyperemic and edematous. Localized crepitating lesions similar to those in the skeletal muscles are occasionally confined to the muscles of the tongue or diaphragm, or even the myocardium. In the latter case, the disease is known as visceral blackwater. The myocardial lesions are often accompanied by a fibrinohemorrhagic pericarditis, and occasionally by one or more mural thrombi in the chambers of the heart. A reddish serous fluid is often found in the thoracic and peritoneal cavities, and the lungs are generally severely hyperemic and edematous. A localized serofibrinous pleuritis may occur adjacent to the lesions in the pericardium. Histologically, the muscle lesions are characterized by extensive necrosis thought to be caused by both the effect of the toxins elaborated by the bacteria, and as a result of vascular involvement. Hemorrhage, the presence of gas bubbles and numerous clostridial organisms as well as the lack of an inflammatory response are also characteristic features of blackwater. The lesions of gas gangrene in sheep following wound infection resemble those in cattle that have died of blackwater. They may be associated with the presence of a severe fibrinous, fibrinopurulent or fibrinohemorrhagic pericarditis in association with locally extensive areas of necrosis in the myocardium. Lambs that have died of the disease following infection by the umbilical route, there is marked congestion of the subcutaneous tissues in the umbilical region and the visceral organs. This is accompanied by petechiation and the presence of a fibrinous exudate on the surface of the liver. The lesions in horses that have died from gas gangrene caused by Clostridium chauvii are similar in nature and appearance to those in cattle. In typical cases of blackwater, a presumptive diagnosis can be made on the basis of the history, clinical signs and lesions at necropsy. It should be borne in mind that in some of the more atypical cases of blackwater characterized by muscle lesions in, for example, the tongue, the diaphragm or sublumbar region, their presence may have to be actively sought during the necropsy. The disease can only be confirmed microbiologically or by the application of immunological staining techniques, which are important if immunoprophylaxis is considered. From the exudate emanating from lesions, approximately 6, thin, air-dried smears should be prepared on microscope glass slides for diagnostic purposes. One should be stained by Graham's method and the others, keeping some in reserve, are used for fluorescent antibody testing in order to distinguish between Clostridium chauvii, septicum and novae. Specimens of affected muscles as well as liver should be collected using aseptic techniques, placed separately in sterile plastic or glass jars and submitted at 4 degrees Celsius to a laboratory for isolation of the organism. For microbiological processing, each specimen should be divided into 2 parts, one of which is heated to 80 degrees Celsius for 15 to 30 minutes before a portion is plated out on blood tryptose agar medium and another portion of it inoculated into Robertson's meat broth containing glucose. The second part should be inoculated into another tube containing the same meat broth medium without it being heated. Clostridium chauvii has fastidious anaerobic requirements for its growth on blood agar. Selective media may be compiled by incorporating antibiotics such as neomycin, kanamycin, polymyxin, oleandomycin, or compounds such as sodium azide, crystal violet or sulfadiazine. The isolation and subculturing of suspect single colonies are required to obtain pure cultures for use in biochemical tests. An indirect immunoenzymatic test, the peroxidase antiperoxidase (PAP) technique was developed and used to detect C. Chovei in tissue sections prepared from experimental cases in sheep. An identification system for C. Chovei using PCR amplification of the 16-estrina gene, RRS, with specific oligonucleotide primers and subsequent restriction digestion of the amplification product was developed. It has advantages over the traditional isolation and identification methods including the immunofluorescence method and in vivo testing procedures in laboratory animals. Differential diagnosis. Blackwater may be difficult to distinguish clinically from other peracute or acute infectious diseases, particularly anthrax. Because most affected animals die suddenly and rapidly become bloated and putrefied with blood-stained fluid oozing from natural orifices, blackwater is difficult to distinguish from anthrax. For this reason, when confronted with animals that have died acutely, it is advisable to examine suitably stained blood smears in order to exclude anthrax before proceeding with a necropsy. Lesions at necropsy are generally easily distinguished from those caused by most other infectious diseases except those due to some of the other clostridial infections that cause gas gangrene or malignant edema. In cases where other clostridial infections are concerned, the identification of the causative species by application of fluorescent antibody techniques is a prerequisite to the institution of control measures. Control. Only a small percentage of animals receiving specific antibiotherapy for blackwater, even if this is instituted early in the course of the disease, recover. Necrotic muscle may slough in animals that do recover. Animals treated in the advanced stages of the disease have no chance of recovery. Systemic treatment with large doses of penicillin for 5 days in addition to accepted surgical methods of wound treatment may result in the recovery of animals suffering from gas gangrene. They do, however, take several weeks to recover fully as lesions that result from sloughing of the necrotic tissue take a long time to heal. Supportive fluid therapy and analgesics should be administered in addition to the antibiotic treatment. Control measures for the prevention of blackwater in cattle and gas gangrene due to C. Chovei infection in other livestock species include the destruction of the carcasses of animals that have died of these conditions by incineration or deep burial. Contamination of wounds and the transmission of spores, or even vegetative forms of the organism, by the use of contaminated hypodermic needles and surgical instruments should be prevented. All susceptible animals should be vaccinated. Sheep that have died from C. Chovei infection should not be skinned in order to salvage the price of the skin. However, if they are skinned, the skins should not be stored in or near shearing sheds. The occurrence of blackwater and wound infections caused by C. Chovei can be adequately controlled by immunization, although the calves of immune dams have colostrum-derived immunity which lasts for up to 3 months and interferes with active immunization. Calves should be vaccinated when 3 to 6 months of age. The initial course of immunization should consist of 2 subcutaneous inoculations administered at an interval of approximately 4 weeks, followed by annual boosters until the animals are 3 years old. On heavily infected farms on which blackwater occurs regularly, the period between booster vaccinations may have to be reduced to 9 months. The vaccine should only be inoculated subcutaneously, and particularly when vaccine is administered during an actual outbreak of blackwater, a separate, clean, sterile needle should be used to inoculate each animal to prevent transmission of the bacteria between them. Several combinations of clostridial antigens in vaccines are available. 8 such polyvalent vaccines may include one or more antigens of the following organisms: C. Chovei, C. botulism, C. tetani, C. septicum, C. novae, C. sordellii, C. hemolyticum, and C. perfringens type C and D. Although there are distinct advantages in using multivalent vaccines, their application may elicit a severe inflammatory response that leads to a decrease in feed consumption and the development of subcutaneous lesions detectable at slaughter. On farms on which problems with C. Chovei infections in sheep are consistently encountered, the animal should be vaccinated routinely, the time of administration being determined by the form of the disease likely to be encountered. In the case of pregnant ewes, Those not previously vaccinated should be vaccinated twice at an interval of a month, the second inoculation being given at least 1 month before lambing. Thereafter a booster inoculation given 1 month prior to lambing is sufficient to protect them from the disease. Not only will ewes vaccinated 4 weeks before parturition be protected from possible infection acquired by contamination of obstetric wounds, but their lambs will be protected by virtue of the passive immunity against infections of the umbilicus as well as wounds resulting from tail docking and castration. If C. Chauvii gas gangrene following contaminated shearing wounds is anticipated, the booster vaccinations should be administered 6 to 8 weeks before shearing. In exceptional instances, sheep may for unknown reasons develop a shock reaction after administration of vaccine. The same vaccines, mono and polyvalent combinations, as for cattle can be used at the prescribed dosage levels to vaccinate sheep. Clostridium septicum infections. Several disease syndromes are associated with Clostridium septicum infection in livestock. Malignant edema and gas gangrene in ruminants, pigs and horses. Brachy or bradsod in sheep, as gangrenous abomicitis, and in lambs and calves after infection of abomasum ulcers. Post-parturient gas gangrene of the perineum, vulva and genital tract, particularly of ewes and does, but also of cows. Malignant edema develops as a consequence of wound infections and is an acute, febrile, highly fatal condition characterized by the presence of an edematous and gangrenous inflammation of the affected parts, as well as toxemia. Clostridium septicum may be a secondary invader, and often occurs in conjunction with other Clostridia. It is considered to be the primary cause of malignant edema in up to 30% of cattle suffering from the disease. Other histotoxic Clostridia associated with gas gangrene in animals are C. perfringens type A or C. novii, C. Chauvii and C. sordelii. Brachy is a highly fatal disease which has, for a very long time, been known to occur in northwestern Europe, principally in Norway, Denmark, North Germany, Iceland and the Faroe Islands, where it is known as bradsot, quick plague. It is also well known in parts of the UK and Ireland, North America and Australia. Brachy is characterized by severe edema and gangrenous inflammation of the mucous membrane of the abomasum and severe toxemia. Some cases of brachy may be due to C. novii and are indistinguishable from the condition caused by C. septicum. Clostridium septicum is a normal inhabitant of the intestinal contents of animals and is a frequent and rapid postmortal tissue invader and common contaminant. The longer the interim period between death and collection of tissue specimens, the better the chances of isolating C. septicum from animal tissues. In EU, losses of livestock, particularly cattle and sheep, as a result of malignant edema, post-parturient gas gangrene and gangrenous abomicitis are often encountered. Etiology. Clostridium septicum is usually a straight or slightly curved, gram-positive bacillus 3 to 6 microns long and 0,4 to 1,2 microns wide. Filaments up to 35 microns long are formed on the peritoneal surface of organs, particularly the diaphragmatic surface of the liver, of infected animals. It often stains unevenly with gram stain. The bacterial cells usually occur singly or in pairs, are motile due to the presence of peritrichous flagella and exhibit pleomorphism and citrins, spindles and barred rods under certain conditions. Spores which are oval, subterminal and distend the cell are formed abundantly. Clostridium septicum is easily cultured on blood agar, and after 2 days incubation colonies are 1 to 8 mm in diameter, slightly raised, circular, semi-translucent, gray and glossy, with markedly irregular to rhizoid margins. A zone of complete hemolysis surrounds each colony. Due to the motility of the organisms, the colonies have a tendency to swarm on solid media which can be prevented by shortening the incubation period, increasing the agar content to 4 to 6%, or by spreading specific antiserum over the surface of the agar plate. Clostridium septicum is anaerobic. Optimum growth is attained at temperatures of between 37 and 40 degrees Celsius, while most strains will also grow at 44 degrees Celsius. Growth ceases at 46 degrees Celsius. The presence of fermentable carbohydrates or serum in the culture medium stimulates its growth. Essential factors to sustain growth of the bacterium on artificial media include biotin, nicotinic acid, pyridoxine, thiamine, cysteine, tryptophan, adenine, arginine, aspartic acid, histidine, isoleucine, phenylalanine, serine, threonine, tyrosine and valine. Clostridium septicum has saccharolytic and non-proteolytic properties and does not produce lipase or lucidanase. 6 different serological groups of C. septicum have been identified, based on combinations of 2 somatic, O, antigens and 5 types of flagellar, H, antigens that may be present. Serological typing is useful in epidemiological investigations of strains isolated from different sources. Clostridium septicum and Chauvii share a common spore antigen, responsible for cross-agglutination between them. Clostridium septicum produces 4 different exotoxins. The alpha toxin is hemolytic, lethal and necrotizing, the beta toxin is a deoxyribonuclease, the gamma toxin is a hyaluronidase and the delta toxin is a thiol-activated cytolysine, an oxygen-label hemolysin, which in the case of septicum is named septicolysin. The delta toxin is hemolytic, and considered lethal and cardiotoxic. Clostridium septicum are ubiquitous in soil, water and the intestinal content of animals. Clostridium septicum alone may be responsible for infecting a wound, or it may be present in combination with one or more of the other histotoxic Clostridia such as Chauvii, perfringens type A or C, Sordellii and Novi, as well as other anaerobic and aerobic organisms. All breeds, sexes and age groups of cattle, sheep and goats may contract malignant edema. Pigs and horses are less susceptible than domestic ruminants, while dogs and cats are resistant or suffer at most from a slight local reaction at the site of infection. Most cases present after infection of wounds such as those caused by surgical procedures, castration, tail docking, and ear marking, in lambs, or contracted during shearing, parturition or vaccination. The failure to use aseptic techniques during surgical operations, sterile equipment when administering intramuscular injections or strict hygienic measures during shearing procedures, predisposes to the development of malignant edema. Post-parturient gas gangrene of the perineum, vulva and genital tract has been reported in cows, ewes and does. It occurs most frequently in Angora goats and Dorper, merino sheep. Multiparous ewes with twins or triplets are more commonly affected than those with single lambs or kids. It is assumed that the entryways of the bacteria are lacerations and contusions contracted during parturition, although the presence of these cannot always be verified. Crow pick is a rapidly fatal form of gangrene in sheep, resulting from an infection of wounds caused by the pecking of crows of animals, such as parturient ewes, which are down and unable to escape from the bird's attack, and the resulting wound forming an ideal site for the proliferation of infecting bacteria such as Clostridium septicum, Novi or perfringens. Crows are carrion eaters and their beaks are often contaminated by Clostridia. Braxy is a disease of sheep in countries with cold winters, and can be closely correlated with the type of husbandry practiced, being particularly prevalent in animals that have to be overwintered on summer grazing. Cases usually occur in autumn and early to midwinter when heavy frost and snow are present. In the USA, however, it tends to occur in the spring. It usually affects animals in good condition of 6 to 18 months of age. The morbidity rate in an affected flock may be as high as 50%. Isolated cases of a disease similar to Braxy have been reported in calves in the USA. Ulcers in the abomasum of calves may also become infected with C. septicum, resulting in gangrenous abomasitis. Pathogenesis. The entrance of C. septicum into the tissues is favored when a mucous membrane or the skin is injured. The presence of effusions, coagulated blood and necrotic tissue are necessary in most forms of C. septicum infections for the provision of the local anaerobic and other conditions required for the germination of spores of the organism and its vegetative growth and toxin production. Once it has become established and has elaborated sufficient amounts of its toxins, particularly alpha toxin, to cause tissue necrosis, the infection becomes self-generating. The pathogenesis of Braxy is not understood. In most cases, the organism invades the mucosa of the abomasum or, more rarely, that of the duodenum, but as there is no obvious predisposing lesion in the affected mucosa which would have allowed such invasion to occur, the precise circumstances under which it does take place remain unknown. As the disease is associated with cold weather, It has been hypothesized that the ingestion of frosted vegetation plays a role in some way, possibly by causing chilling with devitalization and tissue injury of the mucous membrane which, in turn, allows the penetration and proliferation of C. septicum. Absorption of toxins into the bloodstream results in fatal toxemia. A form of gangrenous abomicitis in lambs and calves is associated with infection by C. septicum of abomasal ulcers. Clinical signs and lesions. In animals that contract malignant edema, clinical signs develop within 4 days of infection and are characterized by the development of rapidly expanding edematous swellings, which may or may not be crepitous due to the presence of gas bubbles at the site of infection. These swellings may be associated with lameness if the muscles of locomotion in the region are affected. Horses rapidly succumb to the infection after developing toxic shock and intravascular coagulation. At necropsy, affected areas are infiltrated with large amounts of inflammatory edema which extend into the fasciae. The muscles in the area are either markedly congested or pale reddish or brownish and usually do not contain foci of necrosis. The exudate lacks the typical rancid odor that is so characteristic of C. Chovii infections. The incubation period of Brachy is usually less than 1 day and the duration of the disease may be a matter of a few hours. Death frequently supervenes before any clinical signs are evident. Animals that are seen to be ill usually manifest signs of abdominal pain and bloat, develop a high fever, and are inappetent and depressed. Death occurs within a few hours of the onset of clinical signs. Postmortem changes develop rapidly. Necropsy reveals a marked, diffuse inflammation of the abomasum wall. The abomasum folds are intensely red, may be emphysematous, contain focal ulcers, and are several times their normal thickness due to severe edema. Fibrin may cover the mucosal lesions and the serous of the abomasum over the affected areas in the mucosa. The abomasum content is blood-stained, scant or voluminous and foul-smelling. There are severe degenerative changes in the liver and kidneys, a turbid, reddish-brown peritoneal exudate, and petechial hemorrhages in serosal membranes. Histologically, affected parts of the mucosa, submucosa and adjacent muscular layers of the abomasum manifest a pronounced inflammatory edema, areas of necrosis associated with a neutrophil infiltrate, emphysema, and numerous gram-positive, rod-shaped bacteria in clumps or short chains. Thrombosis may occur in the blood vessels in the submucosa. Clinical signs of post-parturient gas gangrene develop within 12 to 24 hours after parturition and affected animals usually die within 12 to 24 hours of being noticeably ill. The signs include fever, lethargy, straining and in some a dark hemorrhagic discharge from the vulva. The vulva and the perineum are usually severely swollen due to the presence of a marked edema and emphysema. Similar lesions occur in the genital tract, the uterus being atonic, red and emphysematous. Lambs and calves suffering from the condition as a result of the infection of abomasum ulcers with C. septicum show signs of abdominal pain and are often bloated. At necropsy there are usually several ulcers in the abomasum mucosa which are associated with severe edema and emphysema of the mucosa and submucosa, particularly in close proximity to the ulcers. The lesions may become more generalized and involve the mucosa and submucosa of the entire abomasum. Numerous petechial hemorrhages may be scattered in the abomasum mucosa. In some affected animals the ulcers penetrate the wall of the abomasum, resulting in peritonitis and sudden death. A suspicion diagnosis of the disease caused by C. septicum is based on the history, clinical signs and pathology. The diagnosis should, however, be confirmed by bacterial culture and identification of the organisms. As Clostridium septicum is a common postmortem invader, specimens for the confirmation of the diagnosis should be collected as soon as possible after the death of the animal, chilled, and submitted at 4 to 8 degrees Celsius to a diagnostic laboratory. Specimens required for culturing include blocks of the affected tissue, such as muscle, abomasum, and uterus. As in the case of blackwater, 6 thin, unfixed and air-dried impression smears on microscope slides should be prepared from the lesions for gram stain and the immunofluorescent test for the identification of C. septicum. Specimens collected for bacterial isolation should be cultured on blood agar and incubated under anaerobic conditions for 18 to 24 hours at 35 to 37 degrees Celsius. Typical colonies of C. Septicum are selected when the culture is contaminated and subcultured until a pure culture. The bacterium is then identified by biochemical techniques. Differential diagnosis. The clinical signs and lesions of the syndromes caused by C. septicum cannot be differentiated with certainty from those caused by the other histotoxic Clostridia, including Chovii, Novii, Sordellii, or perfringens types A or C. The signs and lesions of malignant edema may also be very similar to those of anthrax, and those caused by the bites of snakes. Treatment of animals suffering from malignant edema and braxy is rarely successful, but may be considered during the early course of the disease. The treatment includes high doses of antimicrobials, including penicillin, aminobenzyl penicillin and cephaloridine, and, if applicable, provision of adequate surgical drainage of the area and irrigation of the site with hydrogen peroxide. The administration of specific antitoxin may be considered. Immunoprophylaxis is the method of choice to control C. septicum infections. A toxoid vaccine, bacterian and/or toxoid combinations or multivalent vaccines are also commercially available under various trade names. Animals that are vaccinated for the first time should receive 2 injections of the vaccine at a 4-week interval and an annual booster thereafter. Subsequently, animals at risk should be vaccinated 3 to 4 weeks before shearing or parturition. Special precautions should be taken when sheep are sheared or animals are castrated or their tails docked. These procedures should be conducted as aseptically as possible. Shearing sheds and pens should be kept as clean as possible and, once cases have occurred, should be thoroughly cleansed and disinfected. Dead animals should be disposed of by incineration or deep burial to minimize the spread of spores. In order to prevent braxy, sheep should, if possible, not be overwintered on summer grazing. If an outbreak does occur, sheep should immediately be vaccinated and placed in another paddock or camp. The yarding of sheep at night and the feeding of hay before allowing them to graze on frosted vegetation is said to be of value in preventing the disease. Vegetative organisms that contaminate instruments are easily killed by sterilization at high temperatures or by chemical disinfectants. The spores, however, are extremely resistant to most forms of sterilization. They are inactivated by exposure to 3% formaldehyde for 30 minutes. Infection with Clostridium novii type A, B, C or D is responsible for a number of distinctive syndromes which are dependent on the respective combinations of exotoxin elaborated by the organism involved. Type C is almost non-pathogenic, although it has been isolated from water buffaloes, Buballus bubbalis, suffering of osteomyelitis. In general, type A infections are associated with swollen head in rams. Black disease, with type B, and bacillary hemoglobinuria, with type D, also known as Clostridium hemolyticum. Rare reports have been published of the association of Clostridium novii with malignant edema in cattle in which the lesions at necropsy are indistinguishable from those of blackwater. In these animals it appears that Clostridium novii, which is often isolated in association with other Clostridia from such lesions, may be present as the only cause of the lesions in about 30% of cases. The clinical signs of cattle suffering from malignant edema caused by Clostridium novii infection have not been described but are considered to be similar to those of blackwater. At necropsy, the lesions in these animals are characterized by the presence of a very extensive, voluminous, clear, virtually colorless, gelatinous infiltrate which occurs subcutaneously and intermuscularly. Occasionally the inflammatory exudate is pinkish to reddish due to hemorrhage. In contrast to blackwater, muscle lesions in association with the inflammatory infiltrate are generally absent, but if they are present, they are small. Clostridium novii is divided into the types A, B, C and D, based on different combinations of soluble toxic antigens produced by the different biotypes. Clostridium novii used to be referred to as Clostridium edematines, a name which still often appears in the literature, while Clostridium novii type D is also known as Clostridium hemolyticum. Although hemolyticum and novii are currently considered to be distinct species, it has been suggested that they be regarded as the same species, as they have common somatic antigens, and the beta toxin of novii type B is indistinguishable from the lethal toxin produced by hemolyticum. They also have similar cultural and morphological characteristics. They do, however, cause different diseases in domestic animals, and different vaccines are used to protect against them. Clostridium novae occurs as part of the microbial flora in soil, marine sediments and intestinal flora of animals. Strains of types A, B and D have been isolated from the liver of normal sheep and cattle. Toxigenic strains are commonly isolated from the soil. Swollen head in rams. Clostridium novae type A is the etiological agent of the swollen head syndrome in rams and is one of the causes of gas gangrene in humans and cattle. Swollen head is an acute, infectious, but non-contagious disease particularly of young rams and is characterized by the development of a pronounced inflammatory edema of the head and neck which develops after wounds often inflicted to the head during fighting have become infected. Etiology. All strains are motile by virtue of their paratrichous flagella, the motility causing swarming on blood agar cultures. The optimum temperature for growth is 45 degrees Celsius, with most strains growing well at 37 degrees Celsius and moderately at 30 degrees Celsius. No growth occurs at 25 degrees Celsius. Strict anaerobic conditions are required for culturing and the presence of fermentable carbohydrates stimulates growth. On blood agar, colonies of C. novae are irregular in outline, round, 3 to 8 mm in diameter, translucent and grayish, and have a ground glass appearance. Spores are formed which are more resistant than those of the other Clostridia, as they can resist the effects of boiling water for 30 minutes. Clostridium novae type A strains produce alpha toxin, necrotizing, edematizing and lethal, gamma toxin, necrotizing and hemolytic, and is a lecithinase or phospholipase C, delta toxin, oxygen label hemolysin, and epsilon toxin, lipase. Type B produces alpha toxin, beta toxin, necrotizing, hemolytic and lethal, and is a phospholipase C or lecithinase. Zeta toxin, hemolytic, eta toxin, tropomyosinase, and a trace of theta toxin, lipase. Type C of Clostridium novae is a non-toxic and essentially non-pathogenic strain which only produces minute amounts of gamma toxin. Type D produces beta and eta toxins and a trace of theta toxin. The alpha toxin of type A is produced during active growth and damages the capillary endothelial cells, resulting in increased capillary permeability in a similar way as the epsilon toxin of C. Perfringens type D. Swollen head is a wound infection that occurs in young rams mainly during the summer months. Tissue damage to the skin and subcutis of the head caused by the animals fighting among themselves results in the development of subcutaneous edema, which is an ideal environment for bacterial growth and toxin production. Pathogenesis, clinical signs and lesions. Infection of the wounds by Clostridium novae type A probably takes place at the time of injury and results in the rapid development of a severe subcutaneous inflammatory edema with swelling of the affected part which often commences around the face and spreads to involve the whole head with extension for a variable distance down the neck. The swelling may be so severe as to interfere with respiration and cause snoring sounds. There may be exudation of fluid through the skin and closure of the eyes due to severe edema of the eyelids and conjunctivae. The appetite is suppressed and the animal goes down, refusing to rise and usually dies within 48 to 72 hours after the onset of clinical signs. At necropsy, the skin and subcutaneous tissues of the head and neck, and the loose connective tissues of the peripharyngeal, perilaryngeal and paratracheal regions are extensively infiltrated with a clear, straw-colored inflammatory edema which oozes from cuts made into the affected tissues and clots readily when exposed to the atmosphere. There are hydrothorax, hydropericardium and edema of the lungs. If the wool is carefully removed from the forehead of an affected ram, one or more insignificant wounds may be detected. The suspicion diagnosis of the diseases caused by C. novae infections is based on the history, clinical signs, macro and microscopic pathology, and the identification of the organism and its toxins using immunofluorescence staining, bacteriological isolation and toxin-antitoxin typing techniques, are used for confirmation. For the latter purpose, specimens of organs, tissues or exudates and airdrete impression smears of lesions are required. Specimens must be collected using aseptic techniques and packed in ice or refrigerated as soon after the death of the animal as possible. They should be kept at between 4 and 8 degrees Celsius until they reach the laboratory. Clostridium novae occurs as part of the normal gastrointestinal microflora and is a common postmortem invader of the organs and tissues in carcasses where it proliferates and elaborates its toxins soon after death. Large numbers of organisms may reach the liver shortly after death or even during the terminal stages of an animal's life. In addition, dormant spores of C. novae may occur in the liver of normal animals, but in too low numbers to be detected by immunofluorescent methods, their presence only being detected after germination and vegetative growth. The results obtained when specimens obtained from the carcasses of animals that have been dead for longer than 24 hours in temperate climates should be interpreted with caution, and the isolation of C. novae from the specimens alone is insufficient evidence to confirm the diagnosis. The impression smears are used for direct microscopic visualization of C. novae after grams, and immunofluorescent staining techniques have been applied. The tissue, organ and exudate specimens are used for the isolation and identification of the microorganism and/or its toxins using conventional bacteriological investigative methods. The presence of the alpha, beta and gamma toxins and the neutralization by type A, B and D antisera form the basis of typing C. novae isolates. The necrotic effects of alpha and beta toxins may be demonstrated either in fluid culture media in which the microorganism has been grown or, more directly, in affected animal tissues. For the latter purpose, a normal saline extract of the lesion is prepared. After centrifugation of the extract, part of the supernatant fluid is divided into aliquots to which either type A antiserum, type B antiserum, type D antiserum or, as a control, an equal volume of normal saline as that of the antiserum solutions, is added. Portions of the aliquots are used for intradermal testing in guinea pigs, a necrotic lesion at the injection site after 24 hours being considered to be a positive reaction. Inhibition of the necrotic reaction confirms the presence of alpha or beta toxin. In addition, beta toxin is also identified by its hemolytic reaction on human red blood cells. For the diagnosis of swollen head in rams, specimens should consist of tissues collected from within 10 mm of the skin wound, about 6 air-dried impression smears made on microscopic glass slides from the same site and, if possible, 20 to 30 milliliters of the subcutaneous exudate. Tissues more distant than about 10 mm from a wound may be free of bacteria and are generally unsuitable for bacteriological and smear examinations. Specimens required for the diagnosis of malignant edema are similar to those for swollen head in rams, while those for black disease and bacillary hemoglobinuria should be comprised of necrotic liver lesions, tissue samples from the kidney and spleen, and 20 to 30 milliliters amounts of peritoneal, pleural and pericardial fluids and urine, as well as 6 air-dried impression smears made from one or more of the liver lesions. Differential diagnosis. In the differential diagnosis of swollen head in rams, the following should be considered: swelling of the head caused by the effects of photosensitization, especially after the ingestion of certain hepatotoxic plants or the mycotoxin spiridesmin produced by the fungus Pithomyces chartarum, which is responsible for the facial eczema, hypoproteinemia resulting from helminth infestations such as Haemonchus contortus, or snake bite. Control. The treatment of animals suffering from novae infections is not always possible, and if it is feasible is not always effective because of their acuteness and short course. If applied, however, it comprises appropriate antibiotic and intensive supportive therapy. Clostridium novae type A is susceptible to chloramphenicol, clindamycin, erythromycin and penicillin. No successful treatment of black disease in horses has been reported. Passive protection of clinical cases of bacillary hemoglobinuria with hyperimmune serum requires the use of large volumes of it to be effective, which generally makes it impractical and very expensive. The use of vaccines containing bacterians and/or toxoids to protect against novae infections in livestock is common and effective and are available commercially under a variety of trade names. The monovalent vaccine for swollen head in rams is administered for the first time to young rams at the age of 4 to 6 months and is repeated after 4 weeks. The resulting immunity persists for approximately 9 months, after which a booster inoculation consisting of a single injection should be given. This vaccine may also be administered to cattle using double the sheep dose in situations when novae type A is responsible for malignant edema or Blackwater-like syndromes. Multivalent vaccines consisting of a combination of bacterians/toxoids of a number of Clostridia including novae types B and D are available. On farms where black disease or bacillary hemoglobinuria is a problem, liver fluke infestations should be controlled, in addition to vaccination. Black disease, and infectious necrotic hepatitis. Clostridium novae type B causes black disease, also known as infectious necrotic hepatitis, principally in sheep and cattle, and occasionally in horses and pigs. Hepatic lesions caused by the migration of immature liver flukes predisposes to the development of the disease in ruminants. Etiology. For details of the etiological agent of black disease, see novae type B infection above. Epidemiology and pathogenesis. Clostridium novae type B is widely distributed in Australia, New Zealand, the UK, Europe and the USA. Carrier animals spread it from farm to farm, the environment being contaminated by bacteria contained in their feces or by organisms released following postmortal decomposition of the carcasses of animals that have died from black disease. Factors which allow the survival of novae in the soil include large amounts of organic matter and an alkaline environment. Ingestion of spores by animals grazing on pasture growing on contaminated soils occurs continually. Some of the spores cross from the intestinal tract into the systemic circulation, from which they are phagocytosed by cells of the monocyte macrophage system in organs such as the liver and spleen, where they may remain as latent infections until some tissue injuries provides the necessary local conditions which allow them to proliferate in susceptible animals and produce their toxins. On farms on which black disease is endemic, a higher percentage of both the soil and animals' livers contain C. novae than is the case in areas in which the disease does not occur. Infection with C. novae may also take place through the umbilicus of lambs and the uterus of ewes. Black disease in sheep has a distribution and a seasonal prevalence which are linked primarily to the presence of hepatic damage caused by the migration of immature liver flukes, mainly Fasciola hepatica and gigantica, but also Dicrocelium dendriticum. The liver lesions are thought to predispose to the development of the disease as they provide loci of necrotic tissue in which the necessary anaerobic conditions prevail for the germination of novae spores and the subsequent proliferation and toxin production of the vegetative forms. A toxemia which is responsible for the death of the animal results. Well-fed sheep in good physical condition between the ages of 2 and 4 years are particularly susceptible, while lambs and yearlings are rarely affected. In cattle there does not appear to be a specific age predilection, nor is an association with liver fluke infestation as clear-cut as it is in sheep. Clinical signs do not set in until shortly before death, and it is common for animals to die rapidly without showing obvious signs of illness. When clinical signs are observed, an affected sheep stands with its back arched and head and neck extended, and manifests severe depression, ruminal atony, coldness of the skin, normal or decreased body temperature, and weak heart sounds. It moves reluctantly, lags behind the flock and soon lies down to assume a position of sternal recumbency, showing rapid and shallow breathing. In some there are signs of hyperesthesia, twitching of the superficial muscles and frothing at the mouth. Death usually supervenes soon after animals go down. Horses may become ill overnight, and die within 27 to 72 hours of the commencement of clinical signs. They are unable to walk, are severely depressed and manifest pyrexia, increased heart and respiratory rates, and severe icterus prior to death. Postmortem changes set in rapidly after death and often hide the characteristic lesions. Cases suffering from black disease, examined in short time after death, will present marked subcutaneous venous congestion and cyanosis which impart a dark bluish to blackish color to the subcutis, and which become apparent when the skin is removed from the carcass. It is to this that the disease owes its name. A focus or foci of necrosis in the liver are the most characteristic lesions, and they occur in addition to the hemorrhagic tracts caused by migration of the immature liver flukes which are present in many of the animals that die of the disease. These necrotic foci are 20 to 30 mm in diameter, sharply demarcated and yellowish-white, and are surrounded by a hyperemic reaction zone. The areas of necrosis are often situated close to the diaphragmatic surface of the liver from where they extend deep into the organ. Large numbers of gram-positive bacilli can be demonstrated in impression smears or in histological sections of these lesions. The capsule of the liver overlying some of the necrotic foci may reveal evidence of a fibrinous peritonitis. Other lesions include marked ascites, hydrothorax, hydropericardium and subcutaneous edema of the ventral thoracic wall. In horses that have died from black disease, a diffuse peritonitis in association with a voluminous, hemorrhagic exudate in the peritoneal cavity, severe congestion of the intestinal tract, and large hepatic infarcts of up to 150 mm in diameter are the characteristic lesions. The methods used for the diagnosis and control of black disease and Clostridium novyi are described previously. Differential diagnosis. Black disease may be confused with other peracute or acute diseases such as other clostridial infections, pulpy kidney disease, malignant edema, and blackwater, and anthrax. The hepatic lesions should be differentiated from those of uncomplicated fascioliasis, and the migratory tracts caused by severe infestations of Taenia hydaceae larvae. Clostridium novyi type D, also known as Clostridium hemolyticum, which has been reported from the same geographical regions as type B, is the cause of bacillary hemoglobinuria, an acute to peracute, highly fatal toxemia of cattle and rarely of sheep, pigs and horses. It manifests with a high fever, hemoglobinuria and icterus, and by the presence of necrotic foci in the liver. For etiology, see the section Clostridium novyi type D, above. Epidemiology and pathogenesis. The epidemiology and pathogenesis of bacillary hemoglobinuria in cattle and sheep are very similar to those of black disease in sheep. Bacillary hemoglobinuria exists only in regions where liver fluke infestation, and C. novyi type D organisms are endemic, and primary injury initiated by these helminths to the liver harboring latent infections of the bacterial spores creates the necessary conditions required for them to germinate, will vegetate and will produce exotoxins. As in the case of C. novyi type B, type D is also a soil-borne organism and is distributed and ingested in a similar manner. Spores reaching the liver lie dormant in Kupffer cells until stimulated to germinate. The beta toxin is not only hepatotoxic and exacerbates the growth of the primary necrotic lesions, but it is also hemolytic, which results in the development of intravascular hemolysis with anemia, hemoglobinemia and hemoglobinuria following its absorption into the systemic circulation. Affected animals succumb from the effects of hypoxia and toxemia. However, unlike black disease, which is essentially a toxemia, in bacillary hemoglobinuria both a toxemia and a septicemia develop. Animals in good condition are more susceptible to the disease. The clinical signs in cattle and sheep suffering from bacillary hemoglobinuria are of rapid onset, and include fever, extreme icterus, and toxemia. The feces are dark and bile-stained, and there is a terminal hemoglobinuria. 18. The pattern of mortality in cattle in regions where bacillary hemoglobinuria is endemic is characterized by the occurrence of sporadic deaths, although instances do occur in which large numbers of animals die in a matter of hours or days. Bacillary hemoglobinuria in horses may present initially as colic, profuse sweating, toxemia, icterus, fever and increased respiratory and heart rates develop subsequently. Hemoglobinuria only occurs terminally. At necropsy, animals that have died from bacillary hemoglobinuria are usually in good condition and manifest severe icterus, hemoglobinuria, hemoglobinuric nephrosis, hepatic degeneration and bile stasis. The blood is watery and clots poorly. Large, single or multiple focal areas of necrosis from about 10 to 200 mm in diameter occur in the liver parenchyma and are considered characteristic of the disease. The necrotic areas are darker than the surrounding liver but contain central pale foci, and are firm, well circumscribed, randomly distributed and raised above the surface of the liver capsule. Histologically, gram-positive bacilli may be detected at the periphery of the necrotic foci in the liver. Diagnosis. A peroxidase-antiperoxidase (PAP) technique was used to diagnose bacillary hemoglobinuria in formalin fixed paraffin-embedded liver specimens of cattle. It could distinguish this condition from infections caused by C. novyi type B, C. Chauvii, C. septicum and C. perfringens types B and C. The PAP technique proved to be a specific, simple and rapid method to diagnose this condition. Differential diagnosis. Bacillary hemoglobinuria in cattle can be confused clinically and pathologically with redwater, babesiosis, leptospirosis, postparturient hemoglobinuria, and hemolytic anemia caused by cruciferous plants and Allium cepa. Clinically, the hematuria present in enzootic hematuria and in some animals suffering from pyelonephritis and cystitis should also be considered in the differential diagnosis. In sheep, the hemolytic crisis, anemia and icterus caused by chronic copper poisoning, and the icterus associated with certain Corynebacterium pseudotuberculosis infections, eperithrozoonosis, plant poisonings caused by hepatotoxic plants and mycotoxicuses such as facial eczema, may be difficult to distinguish from those of bacillary hemoglobinuria. Bacillary hemoglobinuria in horses may be confused with diseases such as babesiosis and leptospirosis. Clostridium perfringens is a typical representative of the genus Clostridium, which requires anaerobic growth conditions. It is widely distributed in nature and occurs in soil, sewage and water, as well as in the intestinal tract of humans and warm and some cold-blooded animals. Clostridium perfringens is usually absent from the stomach, but present in variable numbers, vegetative bacteria and spores, in the small and large intestines of most animals. Vegetative organisms may multiply in soil in counts as high as 5 times 10,000 Clostridium perfringens organisms per gram of soil. Normal human intestinal contents can contain as many as 10 billion organisms per gram, the number being dependent on the diet of the host. In pigs fed on a high-protein diet, the number of perfringens is significantly higher than in pigs on a standard protein diet. Higher fecal counts of perfringens are found in calves aged between 1 and 10 days than in older animals. The different Clostridium perfringens types produce 6 major toxins: alpha, CPA, beta, CPB, epsilon, ETX, iota, ITX, enterotoxin, CPE, and necrotic enteritis B like, net, which are typing them into toxin types A, B, C, D, E, F, G. Each one of these types also produces a number of so-called minor, less lethal toxins. Under certain in vivo and in vitro conditions, the major and minor toxins are produced alone or in combination, depending on the specific type, and are responsible for the pathogenicity of the bacterium. These toxins, alone or in combination, are responsible for the various syndromes associated with this group of organisms. They cause disease as a consequence of their local effects on the intestinal tract, which may vary from insignificant to outspoken, and, where the systemic effect of absorbed toxins will generate, a situation referred to as enterotoxaemia. The effects of these toxins, also referred to as virulence factors, are divided into 3 groups, namely alpha and kappa toxins, which are phospholipase, licidinase, and collagenase enzymes, respectively, will hydrolyze substances essential to the integrity of cellular membranes or other body structures. Beta, epsilon, iota, enterotoxin and net toxins, that are pore-forming toxins. Theta and delta toxins, a group that includes the hemolytic toxins. Clostridium perfringens is associated with a wide variety of diseases that affect most domestic animal species and humans and include enterotoxaemia, hemorrhagic and necrotic enteritis, and gas gangrene. It is one of the most widespread and potential pathogenic organisms in nature. C. Perfringens type F, producing enterotoxin, is an important cause of food poisoning in humans. Clostridium perfringens grows well on rabbit, human, ovine, bovine and equine blood agar at 35 to 37 degrees Celsius in an anaerobic atmosphere. After 18 to 24 hours incubation, the colonies are 2 to 5 mm in diameter, white or gray and translucent, with a glossy appearance, low convex, and round with edges that may vary from irregular/serrated in some isolates to entire in most isolates. Clostridium perfringens tolerates a wide temperature range when incubated and, although the optimal range is 35 to 37 degrees Celsius, temperatures of 43 to 45 degrees Celsius are tolerated. When grown under optimal conditions, the generation time, the time it takes an organism to double itself, of Clostridium perfringens may be as short as 8 minutes, which makes it probably the most rapidly growing organism known. Different media have been composed for the selective isolation of C. perfringens in the presence of other organisms. The addition of antibiotics, such as neomycin, to the tryptanosulfite neomycin medium of Marshall, Steenbergen and McClung, allows selective growth of the C. perfringens organism whilst suppressing the growth of contaminants. The OPSP medium of Hanford and Cavett and Hanford contains oleandomycin, polymyxin and sulfadiazine that suppress the growth of Clostridium bifurmentans, a common contaminant, more effectively than the tryptose sulfite cycloserine medium of Harmon, Cotter, and Peeler. Clostridium perfringens grows in a variety of liquid media. Of these, Robertson's cooked meat medium is probably the best known, since it has been extensively and successfully used for culturing the Clostridia for many years. Clostridium perfringens exist in the feces of animals in different physiological states. It may occur in vegetative cell forms, in sporulating cell forms, as endospores, or as germinating endospores. The physiological states that the bacterium may be in require different methods of isolation to recover it successfully. The methods used include direct culture, pre-enrichment in cooked meat, preheating with or without ethanol, and pretreatment with heat before pre-enrichment. Clostridium perfringens is a gram-positive, short, squat, thick, straight-sided, non-motile bacillus, 0,6 to 0,8 by 1,2 to 4 microns. Very short forms occur under conditions that facilitate rapid growth of the organism. The bacteria usually occur singly or in pairs, and rarely in chains. In animal tissues, but only in certain media, the organisms form a capsule that is demonstrated by negative staining with India ink. The capsule is composed of complex polysaccharides combined with peptides of acidic amino acids. Although the members of the genus Clostridium are characterized as being a spore-forming group of organisms, spores of C. perfringens are rarely seen on standard artificial media or in animal tissues. Media have been compiled that encourage the organisms to produce spores under artificial laboratory conditions. Yields of up to 10 million spores per milliliter have been recorded. It appears that there is considerable variation from one strain to another in the conditions required for sporulation. Spores are oval and located subterminally. Sporulation is usually associated with the formation of enterotoxin, which in humans causes a form of food poisoning characterized by abdominal pain, diarrhea and nausea. The spores are heat resistant, but here too there is considerable variation between different strains, some surviving exposure to 100 degrees Celsius for 1 to 5 hours, while others do not. The majority of spores from heat-resistant strains require heat activation, 75 to 100 degrees Celsius for 10 minutes, to germinate. A variety of carbohydrates and other substances metabolized by C. perfringens are used in the identification and classification of isolates of the organism. For practical purposes, the biochemical reaction should be the same for all C. perfringens types. 90% of C. perfringens strains ferment fructose, galactose, glucose, inositol, lactose, maltose, mannose, starch, and sucrose, liquefy gelatin, produce toxin, and are pathogenic for laboratory animals. The fermentation products formed include acetic and butyric acids, with or without butanol. These reactions play an important role in confirming the identity of C. perfringens but have no bearing on the toxin type. Major and minor toxins produced by Clostridium perfringens, and their effects. Once biochemically characterized, toxin typing is performed by PCR. Because all C. perfringens strains encode the CPA gene, PCR for this gene is currently also used to determine the species. The use of polymerase chain reaction, PCR, technology has led to much improved in vitro test methods for typing. These tests are not only faster to perform, but are also more reliable and specific, and are rapidly becoming the method of choice with which to identify and type strains of C. perfringens. Typing of the various strains by PCR is dependent on the amplification of the CPA, CPB, ITch, CPE and NetBead genes from the relevant Clostridium perfringens strains. The PCR technique can be used to type bacteria in field samples collected from animal tissues, as well as those which have been propagated on solid or in fluid media. Alpha toxin, CPA. All Clostridium perfringens isolates encode CPA. The CPA gene is located in a stable region of the chromosome. The alpha toxin was the first bacterial toxin ever to have its biochemical mode of action elucidated. It is a protein, an enzyme, slightly heat-stable and antigenic, and can be toxided. The alpha toxin is a phospholipase C enzyme specifically defined as phosphatidylcholine F phosphorhydrolase, and has marked preference for phospholipids including sphingomyelin, phosphatidylcholine, lecithin, phosphatidylethanolamin, phosphatidylserine and glycerophosphatides. The main biological features of CPA are its ability to cause localized necrosis of skin, and its in vitro ability to cause hemolysis of erythrocytes of certain animals. The formation of thrombi and venules, capillaries and arterioles is an important early event in the pathogenesis of necrosis caused by the alpha toxin. CPA is a vigorous inhibitor of the calcium pump of cardiac sarcoplasmic reticulum, that may lead to the depletion of releasable Ca++ in myocytes, which in turn causes a reduction of systolic myocardial function and a decrease in contractility. If this decrease in myocardial function is significant, a substantial decrease in cardiac output may be responsible for the induction of shock which occurs in C. perfringens histotoxic infections. Beta toxin, CPB. The CPB gene that encodes CPB is carried on large virulence plasmids of both type B and C isolates, is heat label. CPB is a beta pore-form toxin, which belongs to the alpha hemolysin family. CPB acts on the cytoplasmic membrane of susceptible cells by forming functional pores that allow the ion's influx of calcium, sodium and chlorine into the cytoplasm, and produce cell swelling. These pores also allow efflux of potassium that induces phosphorylation of kinases, which can activate host cell adaptation and survival pathways. CPB is exquisitely sensitive to intestinal proteases, including trypsin. Purified beta toxin has a minimum lethal dose of 4 micrograms in mice. Following administration in ligated intestinal loops in vivo in guinea pigs and rabbits, it causes hemorrhage and necrosis of the intestinal mucosa. Epsilon toxin, ETX. The H gene encoding ETX, is carried on plasmids in type B and D isolates. ETX is not hemolytic, but it is locally necrotizing when injected intradermally into guinea pigs and rabbits, and highly lethal when administered parenterally to laboratory animals such as mice, rabbits, guinea pigs and lambs. It causes increased vascular permeability, which is independent of the release of histamine. In the intestine and central nervous system, ETX has a pressor effect on the blood pressure, which is increased without there being changes in electrocardiographic recordings or heart rate. This is accompanied by a decrease in cutaneous blood flow, suggesting that the toxin exerts a vasoconstrictor effect. Contraction of ileum is induced by the epsilon toxin due to the activation of sodium channels, releasing acetylcholine from cholinergic nerve endings, which in turn promotes the availability of calcium, causing contraction of the smooth muscle. Iodotoxin ITX. Iodotoxin, ITX, produced by C. perfringens type E is a binary toxin that consists of 2 components, an enzyme, Ya, and a binding component, Ib. After binding to its receptor on target cells, the Ib binding component oligomerizes into heptamers that insert into the plasma membrane, forming functional channels, thus facilitating the movement of ions and the translocation and endocytosis of the enzymatic component. Once endocytosed, enzyme Ya translocates itself into the cytoplasm, where it induces depolymerization of actin filaments, and increased G-actin monomers. Injected intradermally in guinea pigs, it is dermonecrotic, and after intravenous injection, it is lethal. Clostridium perfringens type E has only very rarely been isolated from diseased animals. Beta-2 toxin, CPB2. CPB2 is a pore-forming toxin, which was first identified in a C. perfringens isolate obtained from a piglet suffering from necrotic enteritis. Since then, the gene, CPB2, encoding this toxin has been detected in isolates from a wide variety of animals such as cattle, sheep and goats, horses, chicken and swine, and humans with and without enteric disease. Delta toxin. Delta toxin belongs to the ahemolysin branch of the beta pore. The role of delta toxin on the pathogenesis of C. perfringens types B and C disease has not been determined, although it generates 4 nanometers pores on biological membranes, and causes fluid accumulation and intestinal damage in intestinal loops. Perfringulicin O, or theta toxin. PFO, a pore-forming toxin, is the prototype of cholesterol-dependent cytolysins. PFO has high affinity for its cholesterol receptor on the membranes of target cells. The large pores formed by PFO and the plasma membrane of target cells produce lysis by an osmotic mechanism being its main activity. PFO acts synergistically with CPA to cause myonecrosis by contributing to tissue destruction, and preventing bacterial lysis by host immune cells. At high concentrations, PFO is cytotoxic for macrophages and polymorphonuclear leukocytes. Degradative Clostridium perfringens enzymes. The solidases, neuraminidases, are the best studied C. perfringens degradative enzymes. These enzymes generate free sialic acids, from various sialoglycoconjugates, found on host cell surfaces or in mucus. 3 solidases, NANG, NANI and NANH, are produced by perfringens. This enzyme is primarily produced by C. perfringens types A, D and D, and possibly also by types B and C. The kappa toxin is lethal when injected intravenously into mice and causes necrosis when injected intracutaneously into rabbits. Parenteral administration of the toxin to guinea pigs results in extensive destruction of connective tissue and severe pulmonary hemorrhage, plays a role in the development of gas gangrene, myonecrosis, by softening the infected muscle tissue, thus facilitating the spread of the alpha toxin, and promoting the invasiveness of the causative pathogen. Mu toxin is a hyaluronidase produced by most strains of types A and B, some strains of type D and a few strains of type C. The toxin has hemolytic, necrotic and lethal activities, and causes an increase in skin permeability. It has, however, been suggested that, while it does not seem to be essential for the development of gas gangrene, it may well contribute to the severity or rapidity of the development and expansion of the lesions. New toxin is a deoxyribonuclease that is produced by all strains of C. perfringens except by certain type C strains isolated from humans. It is assumed that the new toxin exhibits lethal and hemolytic activities, and it has been demonstrated that it has specific cytotoxic activities in that it destroys the nuclei of polymorphonuclear leukocytes and muscle cells in gas gangrene. The absence of these leukocytes in lesions of gas gangrene bears testimony to this. Confirmation and diagnosis of disease caused by C. perfringens depends on the toxinotype involved. For enteric infections in general, detection of the toxins in intestinal content and/or feces is required. Isolation followed by PCR typing of the C. perfringens isolate is helpful in some, but not in all cases. Some types of C. perfringens, type A, are present in the intestine of most animals, and isolation of this toxinotype has, therefore, no diagnostic significance. For histotoxic infections, isolation or demonstration of C. perfringens by PCR, fluorescent antibody test and/or immunohistochemistry, is diagnostic. Specimens should be collected as soon as possible after the death of the animal. The specimens collected and investigation performed will vary according to the specific disease. Most strains of perfringens are susceptible to metronidazole, penicillin G, erythromycin, chloramphenicol and amoxicillin with clavulanic acid. Antibiotics such as tetracycline and clindamycin are not always effective against these anaerobes. Clostridium perfringens is completely resistant to the aminoglycosides, which include neomycin, streptomycin, gentamicin and kanamycin, and most of the cephalosporins. Strains isolated from pig feces are resistant to tetracycline, erythromycin, lincomycin and clindamycin, a situation possibly associated with the extensive use of these antibiotics in animal feeds. Clostridium perfringens isolated from the intestinal contents of calves is susceptible to chloramphenicol, chlortetracycline, erythromycin, penicillin G, ampicillin, nitrofurantoin, furazolidone and trimethoprim, and resistant to neomycin, streptomycin, kanamycin, gentamicin and polymyxin. In strains isolated from poultry, ampicillin, penicillin G, rifampicin, salinomycin and tylosin appear to be the most effective antibiotics. Antimicrobial agents, such as the aminoglycosides, bacitracin, monensin, nalidixic acid and the tetracyclines, are much less effective. Clostridium perfringens type A is considered to be one of the causes of gas gangrene or malignant edema, arising from trauma, associated with penetrating wounds in cattle, horses and humans. It is a rare cause of gangrenous mastitis in cattle and acute mastitis in sheep. The enterotoxaemia caused by Clostridium perfringens is characterized in several domestic and wild animal species by a number of distinct syndromes that are usually associated with, and therefore referred to as, sudden death. Clostridium perfringens type A has been associated with lambs that succumb to an enterotoxemic condition known as yellow lamb disease in California and Oregon, and with enterotoxemic jaundice in cattle and sheep in Australia. In addition, enterotoxemia in sheep and lambs considered to have been caused by perfringens type D has, on occasion, revealed only perfringens type A. This is a peracute to acute, fatal disease associated with the isolation of C. perfringens type A in pure culture from the intestines of affected sheep. In cattle, perfringens type A is associated with, or is considered to cause, several disease syndromes. Isolated from calves suffering from an acute abdominal syndrome caused by abomicitis and abomasal ulceration. Enterotoxemia caused by C. perfringens type A has been described in calves, wild deer, and water buffaloes, Buballus bubalis. It has also been associated with fatal gastroenteritis or sudden death of cattle. Clostridium perfringens type A is associated in horses with intestinal clostridiosis. Recently an enterotoxigenic strain of C. perfringens type A was isolated from necrohemorrhagic enteritis in a 2-day-old foal. Serological evidence also suggests that the enterotoxin of C. perfringens type A may be involved in equine grass sickness, either as an etiological agent or as a complicating factor, but this has not been confirmed. Clostridium perfringens type A has been reported as a cause of enterotoxemia and death in pigs, and of diarrhea and emaciation in piglets 1 to 3 weeks old. It has, however, been suggested that no special importance should be attached to the presence of C. perfringens type A in pigs suffering from enteritis. Clostridium perfringens type A is recognized as the cause of necrotic enteritis in conventionally reared broiler chickens, as well as in germ-free chickens, while fatal cases of enterotoxemia in birds of prey have been directly attributed to the feeding of meat contaminated with C. perfringens type A. Certain strains of C. perfringens type A causes enteritis in humans and lambs, calves, monkeys and rabbits. The type A enterotoxin is not regarded as playing an integral role in the pathogenesis of the classical enterotoxemia syndrome in animals, although it has been detected in pigs, sheep, goats and cattle. The enterotoxin exerts a local effect on the intestines, inducing a mild and non-fatal disease. Etiology. The cultural, morphological and biochemical characteristics of C. perfringens type A are dealt with in the introduction, Clostridium perfringens group. Although all 5 toxin types of Clostridium perfringens are produced. The alpha toxin, a phospholipase, is the main lethal toxin produced by type A. The term lacidinase, used in the older literature, is a synonym for phospholipase. Epidemiology. The epidemiology of the various syndromes associated, or thought to be associated, with Clostridium perfringens type A infection is poorly defined, primarily because of uncertainty about the etiological role of the organism. There is no doubt, however, about its ubiquitous occurrence in the environment. Clostridium perfringens type A is regarded as being a facultative pathogen in contrast to Clostridium perfringens types B, C, D and E, which are regarded as obligate parasites and, while widespread, not as ubiquitous as type A. Clostridium perfringens type A is considered to be the most common of the 5 types of Clostridium perfringens and occurs as a vegetative organism in the intestinal tract of almost all warm-blooded animal species and humans, and in soil. As far as gas gangrene is concerned, it would appear that the microbial composition of the soil in the area in which the infection has occurred plays an important role in its development and severity. Poor and arid soils contain fewer organisms than fertile and cultivated soil. Direct and indirect fecal contamination of the skin play an additional important role in wound infections, but the advent of antibiotics and vaccines has, however, minimized the importance of these infections and the development of gas gangrene in humans and animals. Humans suffering from malignant neoplasia are prone to the development of Clostridium perfringens associated infections, such as fatal sepsis and massive hemolysis, and necrotizing pneumonia and empyema. Young sheep grazing on lush pastures or which are fed quality carbohydrate and protein-rich diets are particularly susceptible to hemorrhagic enteritis, but it can occur sporadically under conditions of stress such as deworming, weaning and transportation. In calves, type A enterotoxaemia occurs in pale-fed animals in intensive systems under good management. Several incidences have been reported in which water buffaloes, stag and elk, subjected to transport stress and a sudden change in diet, suffered rumen and intestinal stasis and death from Clostridium perfringens type A enterotoxaemia. Animal feeds may be a source of Clostridium perfringens type A and may contribute to its distribution. Feeds play a role in the occurrence of disease produced by perfringens type A in a variety of animal species, from livestock to laboratory animals. Clostridium perfringens type A, either alone or in combination with other Clostridia, is one of a group of anaerobes involved in clostridial wound infection. The spores of these organisms, which are present in soil and feces, are carried into the wound at the time of injury where, under conditions which are not well understood, they germinate, proliferate, synthesize toxin and invade surrounding tissues. The bacteriology of wound contamination and gas gangrene is extremely complex. Only rarely does the infection of wounds by Clostridia alone result in gas gangrene. In the majority of clostridial wound infections, the organisms grow slowly and die within 10 days of the commencement of the infection. The conditions in clean and fresh wounds are barely suitable for clostridial infection to establish itself, but the presence of a watery, seropurulent exudate provides the initial nutriments for some proteolytic organisms, including the Clostridia, to proliferate. Even then, only a slow growth of perfringens without toxin production may occur. 3 types of wound infection involving Clostridia occur. Simple wound contamination, anaerobic cellulitis and gas gangrene or clostridial myonecrosis. Simple wound contamination is the most frequently encountered but the least serious of the 3 types of infection. Invasion of the surrounding tissues rarely occurs and it normally terminates in uneventful recovery. Anaerobic cellulitis, malignant edema, is limited to necrotic tissue initially caused by ischemia or trauma, which supports active growth of C. perfringens accompanied by toxin production. It is initially limited to ischemic and necrotic tissue but then becomes self-perpetuating as a result of the synthesis of its own toxins which enhance the formation of the necrotic tissue required for multiplication of the organism. The alpha toxin causes destruction of erythrocytes, necrosis of tissue cells and increased permeability of the capillary endothelial cells. The production of some minor lethal toxins, which are proteolytic enzymes, contributes significantly to the infection by perfringens type A and its spread along fascial planes and loose connective tissues. As the infection spreads, inflammatory edema and gas production. Gas gangrene is an invasive, anaerobic infection of traumatized or ischemic muscle and is characterized by destruction of tissue, extensive local edema, the production of gas, and profound toxemia, and is the consequence of the effect of alpha toxin, which has a direct toxic effect on muscle. Impairment of the blood supply to the traumatized areas facilitates the growth and toxin production of the organism. The anaerobic conditions and reduction in pH increase activation of lysosomal enzymes and the breakdown of muscle protein. The toxins produced by the bacteria cause death of the living tissue in their immediate surroundings, which allows the organisms to spread slowly through the muscle. The massive local destruction of tissue and the production of toxins result in toxemia and shock. In clostridial mastitis, the organism gains access to the udder, probably through the teat canal or wounds on the teats, during the pre- and postpartum periods. Growth of the organism is accompanied by an acute gangrenous mastitis and the presence of gas in the affected glandular tissue, milk and subcutaneous tissues of the udder. The role of C. perfringens type A in the pathogenesis of enterotoxaemia is based on the isolation of the organism and the demonstration of its toxin in the contents of the affected areas of the small intestine. Abundance of fodder rich in carbohydrate and proteins and low in fiber and cellulose leading to a greater number. Overeating on such diets results in overloading of the rumen and excessive amounts of carbohydrates and proteins reaching the small intestine. This in turn establishes the appropriate conditions for the growth of C. perfringens and the production of its toxin. It has also been established in vitro that it produces toxins and other metabolically active substances during exponential growth, the quantities produced depending greatly on the available nutrients and carbohydrate sources. The administration of tetracyclines to horses has been reported to be responsible for an increase in the intestinal and fecal counts of C. perfringens. The alpha toxin appears to be responsible for the locally occurring extensive hyperemia, hemorrhage, and edema, and the poor coagulability of blood, which is characteristic of intestinal clostridiosis in horses. The degenerative changes in the liver and kidneys, which also occur, are caused by mitochondrial damage inflicted by the alpha toxin. In addition, the new toxin, deoxyribonuclease, appears to be responsible for leukopenia or leukocytosis, the theta toxin, thiol-activated hemolysin, for the myocardial changes, and the kappa toxin, collagenase, with its lethal and necrotizing properties, and the mu toxin, hyaluronidase, for the spread of infection in tissues. Clinical signs and lesions. The length of the incubation period of gas gangrene depends on the number of Clostridium perfringens in the wound, the presence and amount of necrotic tissue and the location of the wound, and it may be as short as 4 to 6 hours or as long as 72 hours. Inflammatory changes such as swelling, pain, erythema and a local temperature increase develop around the wound or infected area. The intensity of the swelling and tenderness of the lesion increase progressively. Anaerobic cellulitis remains localized, whereas in gas gangrene, muscular tissue is extensively involved. The inflammatory edema may remain localized, gravitate to lower areas, or spread to adjacent areas along fascial planes. The affected tissue may crepitate due to the presence of gas. Systemic involvement due to toxemia causes animals to become inappetent, have an increased temperature of up to 41 to 43 degrees Celsius, walk with a stiff gait, have decreased mental alertness and eventually become anergic, prostrate. If a limb is affected, the animal will be lame and, with progression of the lesion, will eventually refuse to move. A serosanguineous, gaseous and malodorous fluid may exude from the wound. Focal areas of skin become necrotic. Clostridial myonecrosis is complicated by shock and often terminates in death. Ewes suffering from perfringens type A mastitis are depressed, pyretic, and have an increased heart rate. The affected mammary gland is hot, swollen, emphysematous and painful, and a brown, flocculent secretion may be expressed from the teat. Other signs include hemoglobinuria, anemia and icterus. Dairy cattle which develop a gangrenous mastitis present with a rapidly developing acute mastitis in one or more quarters. They are depressed, anorexic, pyretic and have congested mucous membranes. The affected quarter or quarters are hot, swollen, hyperemic, and edematous and the subcutaneous tissue over the affected parts may be emphysematous. The supramammary lymph nodes are palpable and the milk from affected quarters has a brownish to reddish color, contains bubbles of gas and has a foul odor. Necrosis of the skin may subsequently develop on the ventral aspect of the udder at the base of the teats, and this will result in sloughing. Animals may die within 48 hours from the initial appearance of clinical signs. The acute abdominal syndrome in neonatal calves, 2 to 21 days old, is characterized by ruminal and abomasal tympany, depression and colic, and in some instances, by sudden death. Some develop diarrhea. In calves that have suffered from the acute abdominal syndrome with tympany, various degrees of abomasitis, which may be erosive or ulcerative in nature, are present, lesions being found particularly in the fundus. Ulcers, when present, are circular or linear, are accompanied by submucosal edema and hemorrhages and may perforate. Milk cows that have died from the sudden death syndrome show marked abomasitis and severe hemorrhagic enteritis. Clinical signs in calves of 2 weeks to 4 months old, that are affected by Clostridium perfringens type A enterotoxaemia, are generally evident only 6 to 24 hours before death but, in some, this may even be as short as 5 to 20 minutes before death. Affected animals are hemoglobinuric, inappetent and depressed, and have increased pulse and respiration rates. They soon become prostrate and die. The mortality rate is high. The morbidity rate on a farm may be high. Lesions in the enterotoxaemic disease of calves are said to resemble those of pulpy kidney disease in lambs and include congested, nephrotic kidneys, splenomegaly, cloudy swelling of the liver, mild congestion and edema of the lungs, epicardial hemorrhages, abomasitis, and severe congestion of the duodenal and jejunal mucosa. Adult sheep and young nursing lambs suffer from peracute to chronic Clostridium perfringens type A enterotoxaemia. In the peracute and acute forms, animals are sick for only a few hours, become separated from the flock, show signs of depression, lassitude, increased pulse and respiratory rates and body temperature, and hemoglobinuria. The animals become icteric, recumbent and usually die. The carcasses of both sheep and calves that die from enterotoxaemic jaundice undergo a very rapid onset and progression of putrefaction. In fresh carcasses, icterus and other evidence of intravascular hemolysis are outspoken, the liver is degenerated, and hemoglobinuria is consistently present. In the case of the hemorrhagic enteritis syndrome, animals may be found dead without any evidence of illness having been noticed, but in those that are seen alive, signs of colic may be evident. Rapid decomposition occurs in the carcasses of sheep dying from hemorrhagic enteritis. Blood-stained fluid may ooze from the nostrils and anus. The characteristic lesions are segments of intense congestion and hemorrhage of the small intestine and a hemorrhagic intestinal content. A scant, blood-stained hydrothorax and ascites are present. Equine intestinal clostridiosis has an acute onset and is associated with apathy, inappetence, a foul-smelling diarrhea, discolored mucosal membranes, and an elevated pulse rate and body temperature. The severity of the diarrhea is variable. The consistency of the feces, which are often dark-colored and malodorous, vary from watery to almost normal. Signs of mild colic are generally present. The conjunctival mucosae may be hyperemic. Severely affected horses move with great difficulty and reluctance, and are eventually unable to stand. The body temperature in most animals is raised to 39 to 40 degrees Celsius, although in some animals it is normal. The heart rate is greatly increased in cases of severe illness and is accompanied by slight elevation of the respiratory rate. Other signs that may be observed include dehydration, sweating and laminitis. Horses manifesting acute severe clinical signs may die within 24 to 48 hours. Mortality rates of about 40% have been recorded. The predominant lesions in equine intestinal clostridiosis comprise a severe, acute typhlocholitis in which the exudate varies from catarrhal to hemorrhagic or necrotic. Degenerative changes occur in the heart, liver and kidneys. Diagnosis and differential diagnosis. The diseases and syndromes caused by Clostridium perfringens type A are not specific and the diagnosis should be confirmed by isolation of the organism and detection of the toxin. Clostridium perfringens type A is always present in the intestines of animals and humans and invades the skeletal musculature and parenchymatous organs shortly after death. Thus, to be significant as a cause of death, perfringens type A must be present in large numbers and isolated in virtually pure culture from specimens of animals suspected to have died of the infection. In these cases, an ELISA that detects levels of alpha toxin as low as 25 nanograms in the supernatant of cultures of Clostridium perfringens type A may be used to determine the presence of the toxin in the intestinal content of animals suspected to have died of enterotoxaemia. Depending on the syndrome, appropriate specimens should be collected to confirm the diagnosis. The morphology of the organisms observed in the smears, the outcome of the toxin typing tests of the intestinal contents with the isolation and toxin typing of the strains isolated from the specimens should be correlated with the clinical signs and lesions at necropsy before a final diagnosis is made. The presence of alpha toxin in the intestinal contents, and the absence of beta and epsilon toxins, may contribute to the decision to make a final diagnosis of C. perfringens type A enterotoxaemia. Any disease that has a rapid course, or that causes sudden death in any of the susceptible species, should be considered as a possible differential diagnosis. Depending on the specific syndrome, copper and plant poisonings and other diseases in sheep and calves in which icterus occurs, milk fever in cows and vitamin E or selenium deficiency in calves and sheep should be considered. Enterotoxaemia caused by one of the other C. perfringens toxin types should also be borne in mind. Hemorrhagic enteritis of sheep should not be confused with red gut of sheep, torsion of the intestinal tract. Control. The passive immunization of susceptible animals to the various syndromes caused by C. perfringens type A following the administration of hyperimmune serum affords immediate protection which persists for up to 3 weeks, and this should be considered during an outbreak. In feedlots, it appears that factors other than immunization affect the prevalence of losses due to the sudden death syndrome. Improved feeding and managemental practices tend to have greater beneficial effects than do vaccination or chemotherapy for the control of sudden death syndrome. Formalin toxoids have been used to provide immunoprophylaxis against gas gangrene and other diseases produced by C. perfringens and its toxins. A combined bacterium and toxoid of Clostridium perfringens type A is available for use in cattle. Lamb dysentery. Infection by Clostridium perfringens type B causes a peracute, acute, subacute or chronic enterotoxaemia in lambs that is also occasionally encountered in goat kids and calves, and rarely in foals. The disease occurs mainly in countries in the Middle East and Europe. The infection has not been reported in the Americas, although anecdotal evidence suggests that cases may have occurred in this region. In lambs, the disease is also known as lamb dysentery and it usually affects those that are younger than 14 days. It is characterized clinically by an acute, hemorrhagic to mucohemorrhagic diarrhea, and rarely, by neurologic signs. Lambs die after a few hours to 2 days in the peracute and acute cases, and after 4 or more days in the subacute and chronic cases. Etiology. The organism grows in the intestinal tract of affected animals where it produces the toxins responsible for the disease. Clostridium perfringens type B encodes alpha, beta and epsilon toxins, and a number of other, usually referred to as minor, toxins. The beta and epsilon toxins are metabolic products secreted during the exponential growth phase of C. perfringens type B in a suitable environment that contains the nutrients required for toxin production. Beta toxin is encoded in a plasmid 14 and its concentration in the growth medium in vitro declines rapidly after prolonged incubation. Epidemiology. Although heavier breeds and crossbreeds are considered to be more resistant, lamb dysentery affects newborn lambs of all sheep breeds to the same extent. Goat kids are also affected, albeit less frequently, and information on the disease in this species is scant. In sheep, the disease seems to be more prevalent during cold weather, while it is rare in autumn, and it does not appear to occur in summer. Clostridium perfringens type B is excreted in the feces of adult carrier animals and sick lambs, thereby contaminating soil and pastures. Although there is little scientific evidence to support this claim, it is thought that C. perfringens type B strains only survive for several months in soil and pastures, and they are also not considered to be part of the normal microbial flora of the soil. The teats of ewes become contaminated with feces and soil, and their lambs acquire the infection per os while suckling. It has been suggested that lambs are more prone to develop the disease on certain parts of a farm, mainly those where ewes and lambs are confined to small areas. Close and prolonged confinement of sheep seem to increase the severity of the disease. The prevalence of the disease decreases when the ewes and lambs are removed from highly contaminated areas. Pathogenesis. Clostridium perfringens type B organisms, ingested within the first few hours after birth of the lambs, colonize the intestines, in all likelihood especially the small intestine, where they multiply and produce their toxins that act both locally and are absorbed into the general circulation. The potent and lethal beta and epsilon toxins are the main virulence factors of C. perfringens type B, and they are, respectively, highly trypsin sensitive, and fully dependent on trypsin for full activation. It is believed that the beta toxin is primarily responsible for the induction of the intestinal lesions, characteristic of type B enterotoxaemia. The role of epsilon toxin in this condition is poorly understood, but it is assumed to be responsible for the lesions, focal symmetrical encephalomalacia, in the central nervous system, in the few cases of type B enterotoxaemia in which such lesions have been recorded. In the portions of the small, and, to a lesser extent the large intestine, where the toxins are produced, multifocal to diffuse necrosis and damage to the blood vessel, develop that cause a malabsorptive diarrhea. The consequent loss of water and electrolytes, especially HCO3, results in severe dehydration and acidosis. Death is the combined result of shock, toxemia, dehydration, and acidosis. Clinical signs. Lamb dysentery is almost exclusively a disease of neonatal lambs, with rare cases occurring in other species. 1 to 7 day old animals are the most severely affected. The disease usually first appears towards the end of the lambing season in a sheep breeding unit. During subsequent breeding seasons, however, outbreaks usually commence 14 days after the first ewes have lambed. When outbreaks initially occur on a farm, lambs of 1 to 3 days old are affected, but during subsequent years older lambs of up to 2 to 3 weeks of age may also contract the disease. The morbidity is 20 to 30% with an expected 100% losses. The incubation period varies from 12 hours to 2 days, and clinical signs are often present within 24 hours of birth. Lamb dysentery may have a peracute, acute, subacute, chronic or mild course. Peracutely affected lambs usually die without manifesting any clinical signs. The course of the acute and subacute disease may extend over 1 or more days while, in the chronic disease, lambs survive longer than 3 or 4 days. Older animals become increasingly resistant, those older than 14 days are only mildly affected and they rarely die. Acutely affected lambs are weak, listless, and suckle sluggishly or refuse to do so, and they may show evidence of abdominal pain and diarrhea, the feces becoming brownish-gray, semi-liquid and blood-stained, and they soon become comatose and die. Subacute affected lambs are dull, listless and depressed, move about sluggishly, lag behind the rest of the flock, often lie down, and are reluctant to stand up and suckle. If they do get up, or when lifted to their feet, they stretch in a peculiar way, in that they may remain standing for a while with their backs arched, obviously in pain. Abdominal pain, bleeding and diarrhea are commonly manifested. Foul-smelling feces are at first yellow and semi-liquid and then become mucus-coated, dark and blood-stained, and are passed with the animal straining severely. A yellow, blood-tinged, fecal discharge caked around the tail base may be evident. Lambs eventually become prostrate, comatose and die. The chronic disease is characterized by listlessness and unthriftiness. The lambs suckle listlessly and seldom drink enough milk to maintain their basic requirements. They frequently lie down and, on rising, stretch their backs in a peculiar way. Their feces are thin, mucoid and bloodstained. Nonspecific neurological signs, including opisthotonus, have been reported in all 3 forms of the disease. Cases of the disease were reported in 7 to 10-day-old calves, characterized mainly by scouring. In the few cases of the disease described in foals, mortality rates of up to 50% have been recorded. The clinical signs included cessation of suckling, pain and a severe, hemorrhagic diarrhea that developed within 48 hours after birth. In fatal cases, the foals became comatose and they died within 12 to 24 hours after first becoming ill. Lesions. In lambs, rare cases of C. perfringens type B infection may present without macroscopic lesions. The intestinal lesions occur predominantly in the ileum, are similar to the necrotizing enteritis caused by C. perfringens type C. They are characterized by a severe, diffuse or multifocal decoalescing, necrohemorrhagic and/or ulcerative enteritis, accompanied by a hemorrhagic intestinal content. In the disease with a more protracted clinical course, little or no hemorrhage may be present in the intestinal tract. In most cases, a clear serous or hemorrhagic fluid is present in the peritoneal cavity. Perforation of the intestinal wall causing a fibrinous peritonitis that can lead to intestinal adhesions may also be seen occasionally. Extraintestinal lesions are those characteristic of toxemia and include congested and edematous lungs, a pale or congested, friable liver, splenomegaly due to congestion, hydropericardium and epicardial and endocardial hemorrhages. Focal symmetrical encephalomalacia, macro and microscopically identical to that seen in chronic cases of C. perfringens type D enterotoxaemia, has been described in a few cases. The macroscopic lesions in the gastrointestinal tract of calves and foals with C. perfringens type B infection are very similar to those described in lambs. No macroscopic lesions have been described in the CNS of these 2 species. Diagnosis. Based on clinical signs, and the macro and microscopic lesions, a presumptive diagnosis of C. perfringens type B enterotoxaemia can be made. While small numbers of C. perfringens type B have rarely been isolated from the intestinal contents of normal animals in some areas of the world, isolation of large numbers of the bacterium from individuals with compatible macro and microscopic lesions is supportive of a diagnosis of C. perfringens type B infection. A final, confirmed diagnosis, however, should be based on the presence of both beta and epsilon toxins in the intestinal content of affected animals. Currently, ELISA is the method of choice for their detection, and there are several ELISAs that detect both toxins in the same panel. Failure to detect beta toxin does not rule out C. perfringens type B as a cause, because this toxin is highly trypsin sensitive and is rapidly broken down soon after its production in the intestine. Therefore, a final diagnosis of C. perfringens type B infection should not be based on toxin detection alone, because if beta toxin has been destroyed by intestinal proteases, such infection may be misdiagnosed as type D. Clinical, pathological and microbiological findings should always be appraised in association with toxin detection when attempting to confirm the diagnosis. Differential diagnosis. Lamb dysentery may be confused with the acute, fatal, neonatal diarrhea caused by enterotoxaemic Escherichia coli K99, from which it can be distinguished by the absence of mucosal lesions that are characteristic of lamb dysentery. Necrotic enteritis caused by C. perfringens type C presents with almost identical macro and microscopic lesions to lamb dysentery, and differentiation should be based on toxin detection and the results of anaerobic culture. Control. Most lambs cannot be successfully treated when suffering from the peracute or acute disease, but the use of antibiotics administered orally together with supportive treatment can save mildly affected lambs. C. perfringens is resistant to the aminoglycoside group of antibiotics, but susceptible to chloramphenicol and penicillin. The treatment of the remaining lambs in an outbreak with anti-type B specific immunoglobulin, if it is available, may be beneficial. During an outbreak of the disease, it is important to isolate affected lambs and their dams as soon as possible. The healthy animals in the breeding flock should immediately be removed to other areas where ewes have not previously lambed, as pens and paddocks that have housed infected lambs may be severely contaminated and serve as a source of infection. It is important that the lambs ingest colostrum within the first 2 to 6 hours of life. To control anticipated or subsequent outbreaks of the disease, pregnant ewes should be immunized to induce the presence of as high a level of protective antibodies in the colostrum as possible, as the passive transfer of maternal immunity to lambs is the only way to protect them from becoming infected during the first days of life. Pregnant ewes vaccinated for the first time should receive 2 injections 4 to 6 weeks apart, the second injection being scheduled to be administered 4 to 8 weeks before lambing. Ewes that were previously immunized require a single booster vaccination 2 to 4 weeks before the expected commencement of parturition in the ensuing lambing seasons. Polyvalent clostridial vaccines containing several different antigens, including C. perfringens type B toxoid, are available in many countries. Most commercially available C. perfringens type B vaccines consist of an alum-precipitated toxoid of the epsilon and beta toxins. Clostridium perfringens type C are associated with hemorrhagic enterotoxaemia in young lambs, hemorrhagic enteritis or enterotoxaemia in calves, hemorrhagic necrotizing enteritis, necrohemorrhagic enterocolitis in foals, necrotizing or hemorrhagic enteritis in neonatal piglets. Clostridium perfringens type C produces alpha and beta toxins as major toxins, whereas minor toxins such as theta and delta toxins are produced less consistently by different strains. There can be little doubt that C. perfringens type C is a cause of hemorrhagic or necrotic enteritis, or enterotoxaemia in very young animals under natural conditions. Type C enterotoxaemia has also been experimentally reproduced in piglets, lambs and guinea pigs. 5 subtypes of type C have been recognized, their identity being based on their ability to produce certain minor toxins. These subtypes have a specific geographic distribution and affinity for certain species of livestock, and include those associated with classical struck in sheep, the Colorado variety from lambs and calves, human necrotic enteritis, and porcine enteritis. All type C isolates produce beta toxin. The classical subtype, isolated from struck in sheep, produces all 3 hemolysins, alpha, theta and delta toxins, a number of other minor toxins as well as the beta toxin. The presence or absence of the delta toxin is one of the distinguishing characteristics between the type C subtypes, as opposed to the presence of the alpha and theta toxins, which are present in most of the other C. perfringens strains, including type C. The morphological and biochemical properties of C. perfringens type C are identical to those of the other types. The disease in sheep has mostly been reported from the UK, Germany, Sardinia, New Zealand and the USA. The neonatal disease may be sporadic and affect individual animals, as in foals, or occur in outbreaks of varying extent annually or during successive gestations as it does in pigs, calves and lambs. It is estimated that in an endemic area up to 25% of piglets, under 5 days of age, can develop a clostridial diarrhea. Struck occurs on a seasonal basis, mainly during the winter or spring. The disease appears to be transmitted by fecal-oral route. Clostridium perfringens type C can live for long periods in the intestine of carrier animals without causing clinical disease. It appears that, of the animal species investigated, pigs carry the largest numbers of the bacterium in their intestinal tract. These animals, as well as diseased animals, are responsible for disseminating the type C organism through their feces. Predisposing factors to disease in piglets include group keeping of pregnant sows, simultaneous farrowing of large groups of sows, group treatment of piglets, and the prophylactic use of antibiotics to which the causative bacterium is resistant. Other predisposing factors which facilitate the occurrence of the disease in piglets include a low gastric pH, a change in the diet, injury or irritation to the intestinal mucosa, antitrypsin factors in the feed, the host's susceptibility, and the presence of trypsin-inhibiting factors in the colostrum. The source of an infection in a previously uninfected pig herd is usually a recently introduced carrier animal, such as a newly purchased boar or replacement gilt. Fecal contamination of food appears to play a minor role, but may be important if it is severe. The bacterium survives in the soil only for a limited period. Adverse weather conditions, such as severe windy and dusty conditions, may result in the distribution of C. perfringens type C spores to non-endemic areas. The pathogenesis of type C enterotoxaemia is not well understood but is associated with the local production of toxins in the intestinal tract, following a rapid and marked increase in the numbers of the clostridia. The beta toxin, which is severely necrotizing, appears to be the major factor in the development of the necrosis of the mucosa of the intestine, which is characteristic of the condition, while some of the minor toxins, which are hemolytic, have little or no significance in the pathogenesis of the disease. Subsequent absorption of toxins into the systemic circulation results in toxemia. The first bacteria to colonize the intestinal tract of newborn calves, lambs, piglets and other young animals are C. perfringens, Escherichia coli and Streptococci, which reached this site after their oral ingestion resulting from the sucking of teats and inanimate objects which contain them. These organisms form part of the normal intestinal flora and inhibit the growth of many enteric pathogens, and any delay in the establishment of the normal bacterial flora results in increased susceptibility of the gastrointestinal tract of neonates to invasion by pathogens. Clostridium perfringens type A is the predominant clostridial type occurring in the intestines of neonates. Under ideal conditions, the C. perfringens type C organisms present in the intestines proliferate excessively and produce beta toxin. The first pathogenic effect of C. perfringens type C, as it occurs in piglets, is noted at the tips of the villi and the small intestines. The presence of both the organism and the beta toxin is required to initiate the pathologic changes necessary to produce the disease. The bacterial cells adhere to the intestinal epithelium in great numbers. This intimate contact enables the beta toxin to exert its deleterious effects directly on the epithelial cells. Toxic damage to the mucosa can, however, still occur without bacterial adhesion taking place. Following the proliferation of the bacteria in the intestinal lumen, the beta toxin produced by them has a marked cytotoxic effect and initially causes a marked damage to the microvilli and degeneration of the mitochondria of the enterocytes. This is followed by progressively developing injury and necrosis, not only of the differentiated VR enterocytes, but also of other cells and the vasculature of the lamina propria. Clostridia penetrate the damaged epithelium and adhere to the basal lamina. The necrosis caused by the toxins extends from the mucosa to involve the submucosa. Thrombosis of blood vessels in the submucosa may develop. Invasion of the bacteria into the tissues has no pathogenetic significance. The extensive damage to the intestinal mucosa increases its permeability to blood proteins and cells, which then enter the intestinal lumen. It also facilitates the absorption of toxin into the general circulation, resulting in toxemia, which plays an important accessory role in causing the death of the animal due to toxic injury and shock. Trypsin inhibitors contained in colostrum may also cause the neonate to be exposed to greater amounts of toxin than older animals since the beta toxin is inactivated by trypsin. Adequate amounts of pancreatic proteases in the intestine protect animals against C. perfringens type C enterotoxaemia, and factors inhibiting or reducing the quantity of these enzymes also predispose animals to the development of the disease. Damage to the intestinal mucosa by other unrelated causes may aggravate the local development of the lesions and further predispose to the development of the enterotoxaemia. The pathogenesis of struk in adult sheep is probably similar to that of the enterotoxaemia caused by C. perfringens type C in lambs and other animal species. Clinical signs. In the peracute and acute forms of C. perfringens type C enterotoxaemia in piglets, most animals are affected within the first week of life, the prevalence being highest during the first 3 days. The course of the disease is very short and is usually not longer than 48 hours, although a few cases may linger on for a few days. Clinical signs may be evident as soon as 7 hours after birth, with affected animals becoming limp and ceasing to suckle. Their hair coat becomes ruffled, and they are pale or have a grayish discoloration of the skin, occasionally show trembling, and have a subnormal body temperature. Diarrhea is not consistently present, but, when it is usually hemorrhagic and may be accompanied by vomiting. Affected piglets also suffer from hypoglycemia, dehydration and metabolic collapse. The subacute and chronic forms of the disease occur in piglets between 5 days of age and weaning. Clinical signs include a non-hemorrhagic diarrhea, emaciation, anemia, hypoglycemia, dehydration, and metabolic collapse. Mortality rates of 42 to 74% have been recorded in the more prolonged disease. Ovine C. perfringens type C enterotoxaemia does not simultaneously affect lambs and adult sheep on the same farm. In lambs, the disease is of sudden onset and short duration, and affected animals usually die within 12 to 72 hours after commencement of the clinical signs. When diseased lambs are seen alive, they are depressed and either pass grayish-black, soft feces or suffer from a prominent mucohemorrhagic diarrhea. They usually have a subnormal temperature, shiver, bleed and may show tetanic spasms. Struk characteristically affects adult sheep. Affected animals are weak and prostrate. Most animals suddenly and unexpectedly become comatose and die without any additional signs being observed, but a few may manifest convulsive fits in the terminal stages. Clostridium perfringens type C enterotoxaemia generally affects 3 to 5 day old calves, though animals in excess of 1 year old may also be affected. The well-fed and vigorous animals are usually the ones to contract the disease. Clinical signs are often not noticed as the course of the disease is usually less than 2 hours, but if they are noticed they include weakness, inappetence, dullness and other indistinct neurological signs, straining to defecate, signs of colic, and hemorrhagic enteritis. Affected foals are usually less than 10 days old and are either found dead or die within 24 hours after the onset of clinical signs, often before the development of diarrhea. Clinical signs usually include a hemorrhagic diarrhea, decreased body temperature, increased respiration and heart rates, anorexia, distended abdomen, dehydration, colic, depression, shock and coma. Affected foals may also manifest leukopenia, cyanosis, acidosis and uremia. Lesions in the neonatal syndromes in the various animal species do not differ significantly from each other. The carcass is cyanotic and severely congested. In piglets, a severe enteritis which is constantly present varies from hemorrhagic to necrotic without appreciable hemorrhage, and occurs predominantly in the jejunum but may involve other parts of the small intestine as well as the large intestine. The zonal distribution of the lesions is characteristic. Alternating stretches of normal and abnormal mucosa may be present. Fibrin threads may cover the serosal surface, and emphysema of the intestinal wall occurs in about 25% of cases. Mesenteric lymph nodes are hyperemic and the peritoneal and pleural cavities contain serosanguinous fluid. Specific macroscopic lesions do not occur in other organs. Lesions in lambs involve the jejunum, ileum and the large intestine, and comprise a severe hemorrhagic to necrotic enteritis. Other lesions are similar to those described in piglets. The carcass of a sheep that has died from struk undergoes rapid decomposition. The lesions are those of an ulcerative to hemorrhagic enteritis, fibrinous peritonitis and toxemia with transudation into the peritoneal, pleural and pericardial cavities. Lesions. Ulcers, when present, are most frequent in the jejunum. Multiple small hemorrhages may occur in the serosal surfaces. In calves, the small intestine is affected by a severe hemorrhagic enteritis. The other lesions are similar to those described in piglets. The nature, extent and distribution of lesions in foals vary. A severe and extensive hemorrhagic enteritis is generally present. This may involve the entire length of the small intestine with the exception of the proximal duodenum, only the jejunum, or segmental sections of it. A diphtheritic pseudomembrane may be present in affected parts of the intestine, in which case the overlying serosal surface is also markedly congested. In some animals, however, distension of the stomach and entire small intestine by gas and fluid may be the only evident lesion. Histologically, the lesions comprise necrosis of the intestinal mucosa, and the presence of gram-positive, rod-shaped bacteria in the affected areas. Necrosis may extend into the submucosa and sharp demarcation between the living and the necrotic tissue is characteristic. A suspicion diagnosis of C. perfringens type C enterotoxaemia in the various animal species is based on the clinical signs, history and macroscopic and histopathological lesions, but bacteriological isolation of the organism, together with, if possible, the detection of beta toxin in the intestinal contents, is required for the confirmation of the diagnosis. The isolation of the organism in pure culture from animals manifesting typical lesions is usually more easily achieved than the demonstration of beta toxin in the intestinal contents. In addition, in the case of struck, smears made from skeletal musculature should be submitted. The absence of gram-positive bacilli in the smears excludes a diagnosis of clostridial enterotoxaemia. The presence of many gram-positive, non-sporulating bacilli is indicative of the disease but does not necessarily confirm an etiological role for it. The presence or absence of toxin in the intestinal contents is determined biologically in mice or guinea pigs after the contents have been centrifuged to remove solid particles and the supernatant fluid filter sterilized. Beta toxin can be detected by the toxin neutralization test or the enzyme-linked immunosorbent assay, ELISA, which allows the differentiation between C. perfringens types B, C and D enterotoxaemia. The presence of beta toxin alone indicates a C. perfringens type C enterotoxaemia. Differential diagnosis. Clinically, the neonatal disease in pigs may be difficult to distinguish from other enteric diseases, such as Escherichia coli enteritis, salmonellosis, transmissible gastroenteritis in pigs, hypoglycemia and C. perfringens type B infections. Acute colic, intestinal displacement, gastrointestinal ulceration, hemorrhagic necrotizing enterocolitis due to Clostridium difficile infection, and the ingestion of toxic substances are included in the differential diagnosis of type C enterotoxaemia in foals. In sheep, enterotoxaemia caused by C. perfringens types A, D and B must also be considered. Control. The rapid course of the peracute and acute disease precludes any therapeutic intervention. The use of antibiotics and supportive treatment can be considered when the course of disease is prolonged. It should be kept in mind that the Clostridium group of organisms has an inherent resistance to the aminoglycosides. In endemic areas, oral penicillin or amoxicillin may be administered to neonates as soon as possible after birth in order to decrease the population of C. perfringens in the intestine. As placental transfer of immunoglobulins from the dam to the fetus does not occur in pigs, horses or ruminants, the prophylactic use of specific antiserum to the beta toxin of C. perfringens type C is advocated in order to protect newborn animals. The antiserum may be administered orally or parenterally and provides passive protection within a short period of time, 1 to 2 hours, which persists for 14 to 20 days. Bacterian and toxoid vaccines are produced and are commercially available in the USA, Europe, Australia, and New Zealand. The application of a vaccination program under field conditions is a satisfactory measure to ensure protection against type C enterotoxaemia. This procedure will ensure that their colostrum contains sufficient antitoxin levels to protect their offspring. Cows immunized with a single multi-component bacterian and toxoid Clostridium vaccine 4 months before calving have adequate antibody titers to protect against the clostridial diseases including those caused by Clostridium perfringens type C. The serum antitoxin titers of neonatal pigs are directly proportional to that in the colostrum of their dams and are the highest on the second day after birth. The use of an autogenous bacterian vaccine in herds in which the disease is a problem seems to give better results than commercially available bacterian and toxoids. It has also been found that the subcutaneous injection of 5 ml of C. perfringens type C and D antitoxin in calves within 8 hours of their birth is protective. Lambs actively immunized with a C. perfringens type C toxoid are protected against infection with the organism following its introduction into the duodenum. They can also be protected at birth by the administration of lamb dysentery antiserum. Adult sheep should also be immunized in the event of struck being diagnosed. Clostridium perfringens type D infections. Pulpy kidney disease is a peracute, acute or occasionally chronic infectious enterotoxaemic disease that is common in sheep, uncommon in goats, and cattle. It is caused by the systemic effects of Clostridium perfringens type D, epsilon toxin, which is absorbed into the general circulation from the intestinal tract where it is elaborated by the rapidly multiplying organisms. Pulpy kidney disease in sheep affects animals of any age, but young animals in good condition are particularly susceptible. Predisposing factors, such as sudden changes in diet from poor to good quality, precipitate the occurrence of the disease. Peracute and acute cases are characterized by sudden death, and chronic cases by the development of a neurological syndrome that results from focal symmetrical encephalomalacia. In goats, the disease may be peracute, as in sheep, or it may manifest as an acute or chronic diarrhea due to enterocolitis terminating in death, or as a chronic, lingering and debilitating condition. Pulpy kidney disease occurs all over the world wherever small ruminants are maintained. The bacterium, now known as C. perfringens type D, occurs in large numbers in the intestinal tract of normal sheep without causing any clinical signs and can be regarded as an obligate parasite. Etiology. Clostridium perfringens type D has the same morphological and biochemical characteristics as the other members of the perfringens group and produces 2 major lethal toxins, alpha and epsilon, and a number of minor toxins, which may be either lethal or non-lethal. Epsilon toxin, the significant major toxin and cause of pulpy kidney disease, is produced as a prototoxin. Epidemiology. Pulpy kidney disease is one of the most important diseases of sheep in many other parts of the world. It occurs in sheep of all ages, but most commonly in lambs of 2 age groups, from 3 weeks to 3 months, and from 6 to 12 months of age. Cases of perfringens type D enterotoxaemia have been reported in 7 to 10-week-old calves, in young cattle in good condition up to 2 years old, as well as in adult animals. Though cattle of all ages are affected, it is mainly a disease of calves and young cattle up to 2 years of age in feedlots. In the USA, perfringens type D is associated with overeating disease or sudden death of feedlot cattle. As opposed to the disease in sheep, it only affects individual animals over a period. In goats, most outbreaks have been reported in dairy animals, although it has also been described in Angora goats under extensive conditions in Africa. The condition in goats appears to be poorly understood and has not been properly defined. Significant differences occur between pulpy kidney disease in goats and sheep. In endemic areas, Clostridium perfringens type D is harbored in the alimentary tract of animals as an obligate parasite, and its presence in this situation provides the focus for a potentially fatal infection. Small numbers occur in the forestomachs, but not in the abomasum. The numbers increase towards the ileum, where most Clostridium perfringens organisms are found. Conditions here are ideal for the organisms to multiply under normal conditions. The numbers become less in the large intestine, but sufficient numbers of the organism are excreted in the feces to allow its bacteriological isolation. As is the case with type B, type D isolates are not considered part of the microbial soil flora, as they cannot compete with type A isolates in this habitat. Clostridium perfringens type D is, however, able to survive for a number of months in soil before dying. There appears to be a number of predisposing factors which precipitate the occurrence of the disease. These include stasis of the intestinal tract, sudden changes in the feeding regimen, Sudden changes from poor to lush pastures, grazing on fodder crops, such as green oats, green wheat and green lucerne, very high protein diets, overeating on concentrates and lush pastures, 2060 worming, and coccidiosis. Sudden changes in the weather and wilting of pasture grasses have also been recorded as playing predisposing roles. Under experimental conditions, pulpy kidney disease is induced within 25 hours of infusion of perfringens type D cultures. For sheep, this period may vary from 2 to 5 days under natural conditions. Focal symmetrical encephalomalacia may occur either as a sporadic disease involving one or a small number of sheep, or in outbreak form. Sheep of all ages are affected, although it is often the case that when FSE does make its appearance in a flock, 2 specific age groups of animals are particularly affected: weaner lambs up to the age of 10 to 12 weeks, and mature sheep, 3 years of age or older. The factors which predispose to FSE are the same as those in pulpy kidney disease, cases often being preceded by a change to a lush pasture or by anthelmintic drenching. Focal symmetrical encephalomalacia is more likely to occur in flocks with a partial immunity to perfringens type D. The interval between exposure to the predisposing factor and the clinical signs is usually 2 to 14 days. Pathogenesis. Clostridium perfringens type D is present as a commensal in the lumen of the intestinal tract and proliferates profusely when conditions in the intestinal lumen become suitable for it to do so, such as those which may arise when the diet of a ruminant is suddenly changed from a poor to rich one, or if an animal engorges on palatable feed. If its feed is suddenly changed to one with a high starch content, such as one of the cereals, particles of starch, which would be converted to low-chain fatty acids in the rumen of an animal adapted to its diet, pass unchanged from the rumen into the intestine. The starch is used by the saccharolytic Clostridium perfringens type D, which multiplies rapidly and elaborates large amounts of epsilon toxin, as well as its other toxins. Small amounts of the epsilon toxin in the intestinal tract have no effect on the intestinal mucosa, but large concentrations increase its permeability so that within a number of hours large amounts of toxin are absorbed into the systemic circulation. The mu toxin of C. perfringens type D also increases the permeability of the mucosa. Epsilon toxin is endotheliotoxic and, after attaching to binding sites on capillary endothelial cells to form large complexes, remains associated with the cell membrane to induce the development of large pores. The consequence of this cell injury is a rapid loss of intracellular ions of potassium, and increased levels of intracellular ions of sodium and chlorine. Further progression of cell injury is associated with increased intracellular concentrations of calcium ions and cell death. Systemically absorbed epsilon toxin causes an increased permeability of capillaries in many organs, including those in the intestinal mucosa, thus further enhancing the absorption of the toxin. Epsilon toxin selectively binds to the luminal surface of the endothelium of capillaries of the brain and, to a lesser extent, of other organs, such as those in the kidneys that surround the loops of Henle and the distal convoluted tubules and the hepatic sinusoids. The extracellular edema that develops in the brain is the result of the breakdown of the tight junctions of the vascular endothelium, and is responsible for the main clinical signs of pulpy kidney disease, particularly the neurological signs that are manifested by the acute cases. It appears that mechanisms other than those associated with edema are involved in the development of nervous signs seen in pulpy kidney disease. In FSE, the lesions in the brain progress sequentially, within a period of 7 days, from an initial vasogenic edema to the development of bilaterally symmetrical Malisic foci, that principally involve the white matter of certain areas of the brain. The majority of animals suffering from pulpy kidney disease become hyperglycemic and glycosuric, but the precise pathogenetic mechanisms responsible for this development remain unresolved. The lesions in the brain of goats suffering from natural and experimental pulpy kidney disease reflect the presence of, respectively, severe microangiopathy and an associated perivascular proteinaceous exudation, and severe vasogenic edema. The course of the acute form of the disease in lambs is very short, often less than 2 hours and very rarely more than 12 hours. Many animals are, however, found dead without any premonitory signs of illness being noticed. Usually, the first indication of the disease in a flock is the finding in the morning of sheep that have died overnight. When affected animals are closely observed, the first transient signs to be noticed include dullness, depression, facial movements and loss of appetite. Signs preceding death indicate severe neurological signs and include hypersensitivity, listlessness, hyperesthesia, staggering gait, knuckling of the fetlocks, ataxia progressing to recumbency, clonic convulsions, opisthotonus, marked salivation, stertorous respiration between convulsions, and terminal coma. The body temperature is usually normal but may become elevated if the convulsions are severe. Young lambs, 3 to 4 weeks old, may suffer from colic and manifest abdominal bloating before death supervenes. Manifestations of the disease in adult sheep are similar to those in lambs, but the course of the disease in some may be as long as 24 hours. The clinical signs of FSE vary according to the acuteness of the disease and involve only those which indicate impairment of the central nervous and alimentary systems. Two different syndromes are seen: an acute neurological disorder, the so-called stagger syndrome, in which sheep are unable to stand and with death occurring within 24 hours, and a more chronic evolution, the dummy syndrome, in which the sheep can stand but show general weakness or paresis when handled. In the field, animals suffering from the latter syndrome usually die within 7 days of developing clinical signs, but they may linger for up to 14 days. If nursed, they may survive for a longer period. Animals suffering from either of these syndromes have no consistent abnormalities in body temperature or respiratory or heart rates. An animal suffering from the acute stagger syndrome of FSE is usually found in lateral recumbency and comatose but, when stimulated, shows normal or exaggerated motor responses. It appears to be blind, lacks the eye preservation reflex, and when handled, develops opisthotonus. Spontaneous convulsions are rare. Nystagmus is seen in about a quarter of affected animals. The rumen is usually atonic and the feces invariably soft and pasty. Animals suffering from the dummy syndrome lose their fear of dogs and humans, wander around aimlessly, and manifest head pressing and teeth grinding. Severely affected sheep lack fine muscular coordination and are blind. The sheep are inappetent and show paralysis of the muscles of prehension, thus losing their ability to eat and drink. There is usually ruminal stasis and the feces are pasty and unformed. When lying, they assume a position of sternal recumbency, which is also the position in which they die. 3 syndromes of C. perfringens type D enterotoxaemia have been reported in goats. The peracute or sudden death syndrome is similar to that in sheep. The acute syndrome is characterized by an acute diarrhea and signs of abdominal discomfort, often culminating in recovery or death 2 to 4 days after the onset of clinical signs. The chronic syndrome may persist for days or weeks and is characterized by diarrhea and progressive weight loss. Clostridium perfringens type D enterotoxaemia in cattle generally occurs in the form of sporadic outbreaks. The peracute disease is characterized by sudden death, and the acute by nervous signs and a subnormal body temperature. The animals appear dull and listless, and wander around aimlessly. There are signs of colic and salivation, and when they become prostrate, they assume a position of lateral recumbency and manifest opisthotonus. They show depression, anorexia and appear to be blind before expiring or recovering completely. Lesions. Sheep that have died from pulpy kidney disease are usually in good condition. The rapid onset of postmortem changes is characteristic, particularly those in the kidneys, which develop more quickly than in other organs, the rapid autolysis soon reducing the renal cortices to a pulpy mass. Lesions in sheep dying from the peracute to acute disease are not constant and may be virtually absent in some. When present, one or more of the following may be observed to some degree: varying numbers of petechial or ecchymotic hemorrhages in the subcutis of the dorsal region of the neck, shoulders and rump, petechial or ecchymotic hemorrhages in the parietal peritoneum, muscles of the flank, the muscular portion of the diaphragm, epicardium and endocardium, especially that of the left ventricle, and thymus, an excessive amount of fluid in the pericardial sac, which clots partially when exposed to air, congestion and edema of the lungs, distension of the small intestine, which may be patchily congested and contain gas, even in a fresh carcass, mild to moderate nephrosis and partial, blotchy, to complete congestion of the renal cortices. The degree of postmortem changes present in the kidneys may be gauged by comparing them to those in the liver. In addition, these changes may result in the postmortem degeneration and rupture of the walls of small blood vessels and the consequent presence of small, scattered cortical hemorrhages, and glycosuria, which may disappear with the passage of time due to the post-mortem growth of bacteria in the urine. In the majority of cases there is no macroscopic evidence of enteritis in animals dying peracutely, although intestinal congestion is present in some cases. In very young lambs dying of pulpy kidney disease, the abomasum may suffer rupture in terminal states. The most prominent hematological and biochemical changes occurring in lambs after the parenteral administration of epsilon toxin include hemoconcentration, anhydramia, metabolic acidosis, hyperglycemia, glycosuria, and an elevation of the blood concentrations of pyruvate, lactate and alpha-ketoglutarate as a result of the increase in circulating glucose. In goats that have died of the peracute disease, lesions may be similar to those in sheep. In the acute to chronic disease, a severe pulmonary edema and changes in the intestinal tract are the most consistent lesions. A hydropericardium containing a fibrin clot similar to that in sheep is not always present in these animals. The lesions in the intestinal tract are those of a fibrinous to fibrino-necrotic enterocolitis. The intestinal content may be green or red tinged and mucoid and may in some instances contain pure blood. The presence of mucofibrinous casts in the lumen of the large intestine is a constant finding, and numerous ulcers may occur in the intestinal mucosa. Mesenteric lymph nodes are swollen and edematous. In sheep that have died from FSE, the only lesions consistently present, although they are frequently microscopic, occur in the brain. Those that have suffered from the acute FSE syndrome may also manifest some of the lesions present in pulpy kidney disease. Lesions in the brain are bilaterally symmetrical and two general patterns of distribution are recognized. Areas of leukoencephalomalacia may be present in the internal capsule, dorsolateral thalamus, substantia nigra, basal ganglia and cerebellar peduncles, the most constant sites being the thalamus and the midbrain areas or the white matter of the frontal lobes. Areas of malacia are better seen in formal and fixed brain tissue. Three basic histologic lesions occur in the brain of sheep affected by FSE. These are widespread perivascular edema, perivascular hemorrhage and malacia. Areas of malacia are always focal and sharply demarcated, and are often accompanied by hemorrhage, but lack an inflammatory reaction. Ultrastructurally, there is swelling of astrocytes, the perivascular edema being caused by their swollen end feet, and severe damage to vascular endothelium is apparent. No consistent clinical pathological changes are encountered in sheep suffering from FSE. In some, however, hyperglycemia and glycosuria may be present. Lesions in cattle closely resemble those of pulpy kidney disease in sheep. Differential diagnosis. Diseases and conditions known to cause sudden death, and in particular other clostridial enterotoxaemias, such as that caused by Clostridium sordellii, should be considered as differential diagnoses. Diseases of particular importance in the differential diagnosis of pulpy kidney disease include heartwater, blue tongue, Rift Valley fever, the plant poisonings leading to sudden death. Listeriosis and nutritional myopathy in calves, milk fever in cows and acute lead poisoning may be confused with enterotoxaemia. Focal symmetrical encephalomalacia may be confused clinically with cases of hypocalcemia, copper deficiency, cholesepticemia, pregnancy toxemia, neurosis, cerebrocortical necrosis, cranial abscessation, botulism and tick paralysis. A presumptive diagnosis of C. perfringens type D enterotoxaemia may be based on the clinical signs, lesions and history as well as on the demonstration of the presence of epsilon toxin and C. perfringens type D in the intestinal content. The use of a specific polymerase chain reaction to detect the presence of genes encoding the toxins, alpha, epsilon and beta, of Clostridium perfringens in formal and fixed, paraffin-embedded intestinal tissues of sheep and goats can now also be used to confirm the presence of the bacteria. This method is very specific and highly sensitive and correlates well with the results of conventionally culturing the bacteria. Confirmation of the diagnosis is, however, not always easy as the causative organisms are normal commensals in the intestinal tract and epsilon toxin may occur in the intestinal lumen of animals immune to the toxin but which have died from other diseases. In addition, failure to demonstrate the presence of the toxin in a typical case does not necessarily preclude the diagnosis of pulpy kidney disease. Additional evidence for the confirmation of the disease may be obtained by histological examination of the brain of sheep. Even though signs of malacia may only be macroscopically present in about 30% of cases, Histologically, the combined presence of severe edema, hemorrhages and malacia in the brain stem and midbrain areas is highly suggestive of pulpy kidney disease and is considered by some to be the most reliable way of diagnosing enterotoxaemia in sheep. The malicic areas are invariably focal and bilaterally symmetrical. 10. Demonstration of low serum antibody levels on a flock basis may provide further supporting evidence for the diagnosis. Epsilon antitoxin levels exceeding 0,15 units per milliliter virtually exclude a diagnosis of pulpy kidney disease. In order to determine the immune status of the flock, submit individual samples each consisting of 10 milliliters of serum from at least 10 different animals. Specimens from dead animals should be taken as soon as possible after their death. As putrefactive changes interfere with diagnostic procedures and may preclude the making of a diagnosis, those for bacteriological and toxicological examination should be collected by using aseptic techniques, and they, as well as the samples of urine, effusions and serum samples, should immediately be refrigerated or packed in ice and kept in the cold state until received by the diagnostic laboratory. Several in vitro immunological assays for the detection of epsilon toxin in specimens are available. Control. Animals affected by pulpy kidney disease invariably die too acutely to allow any form of treatment. The simultaneous administration of a hyperimmune serum to epsilon toxin and a Clostridium perfringens type D oil adjuvant vaccine to 3-month-old susceptible lambs has been found to give passive protection for 14 days without any interference occurring in the development of an active immunity. Managemental practices should be altered to reduce those conditions which are known to predispose to C. Perfringens type D enterotoxaemia. In lambs, tail docking, castration and marking should be performed at an early age so as not to cause a reduction in feed and milk intake, as these are conducive to the development of the condition. It is also to be recommended that managemental practices be so designed that sudden changes in the diet of animals, particularly from a poor to a carbohydrate-rich one, or overeating, are prevented. If such changes can be anticipated, the animals should be vaccinated prior to the event. It may be advisable to vaccinate before drenching with anthelmintic if a flock's immune status is in doubt. An alum precipitated C. Perfringens type D, pulpy kidney, epsilon toxoid vaccine is used to protect lambs from pulpy kidney disease. Good immunity is induced by 2 vaccinations at a month's interval, but it is short-lived, lasting only 15 weeks. Emulsifying the epsilon toxoid in complete or incomplete Freund's adjuvant induces the development of an adequate level of immunity which persists for 2 years after a single injection, but this formulation unfortunately gives rise to unacceptable tissue reactions at the site of inoculation. A number of multi-component clostridial vaccines are available which, inter alia, protect against pulpy kidney disease. Young lambs between 2 and 44 days of age do not respond well to immunization against pulpy kidney disease. The presence of colostrum-derived passive immunity in lambs born of immune dams protects them for 13 to 19 weeks and does not interfere with their ability to respond to active immunization. The vaccine regimen in lambs 2 to 3 months of age should consist of the administration either of 2 doses of an oil adjuvant vaccine at an interval of 4 weeks, or of an oil adjuvant vaccine followed 4 weeks later by an alum precipitated vaccine. This gives rise to a good immune response which remains effective for at least 6 to 8 months. An alum precipitated vaccine given as a booster at this stage results in an immunity which lasts for at least a year. Annual immunization thereafter with an alum precipitated vaccine should provide sufficient protection against C. Perfringens type D enterotoxaemia. Animals vaccinated for the first time against the disease show serum antibody titers after a period of 10 to 14 days. Adult animals vaccinated for the first time are given the oil adjuvant vaccine followed 4 to 6 weeks later by the alum precipitated vaccine. This is repeated after 6 to 8 months, thereafter annually. In order to provide young lambs with a colostrum-derived passive immunity which will protect them until they are old enough to be actively immunized, pregnant ewes may be vaccinated. Ewes which have been previously inoculated require only a single vaccination 4 weeks before lambing, while those which have not been previously immunized should be vaccinated twice, at an interval of 4 to 6 weeks, the second injection being given about 4 weeks before lambing. The antibody response of goats to vaccination is similar to that of sheep, but in spite of the development, following repeated vaccinations, of serum antibody levels which should be protective, The disease itself is not effectively controlled. The administration of the vaccine to goats may, in addition, give rise to the development of persistent lumps at the site of the injection, which may be confused with caseous lymphadenitis lesions. The efficacy of the C. perfringens epsilon toxoid and incomplete Freund's adjuvant and in aluminium hydroxide adjuvant under experimental conditions has been demonstrated. A new development in biotechnology has led to the production and use of an anti-idiotypic antibody against the epsilon toxin of Clostridium perfringens type D. This anti-idiotypic antibody recognizes variable region determinants on specific antigen-binding antibodies. It has been demonstrated that this anti-idiotypic antibody can be used to generate an immune response against the epsilon toxin in animals which have not been exposed to the toxin.